Okay, then I would like to call this meeting of the Animal Rehabilitation Task Force of the Veterinary Medical Board to order. And we'll start with a roll call, please.
Dr. Nunez.
Here.
Lee Heller.
Here.
Dr. Klingborg.
Here.
Karen Atlas. Here. Sandy Gregory. Kristen Hagler. Here. Dr. Holland. Here. Dr. Schlachter. Dr. Sims.
Here.
Dr. Troy. Here. Dr. Van Dyke.
Here.
Dr. Waldman. Here. Dr. Chow. Shala Barr. Bill Gage.
Here.
Carrie Ann Calais. Here. Valerie Fenstermaker.
Here.
And Leandra Clark.
Do we have a quorum?
Oh, you know what? I think I missed. Sorry.
Oh.
Dr. Spring Holland? Okay. Did I call your name? Oh, I did. Okay.
I think we have a quorum.
Yeah.
All right. Welcome back. It's nice to see everyone here again. We are being webcast, and the microphone in front of you should have a little red light, meaning it's activated. If the red light's not on, it's not activated. There are restrooms out the door and to the right. The men's restrooms on the left, and you have to turn the corner where it says Senate offices to get to the ladies' restroom. Make sure that all of your cell phones are on airplane mode, and if it's a Samsung Galaxy, get it out of the room. I know that we've called roll call, but for the purpose of first-time viewers and members of the webcast, I would like the task force members just to announce their affiliation. You are all stakeholders on this issue, and so just state that for us, and I'll start. I'm Mark Nunez. I'm a veterinarian. I practice small animal medicine in Hollywood, California, the center of the universe. I'm also currently on the Veterinary Medical Board, serving as board president. And the current chair of this task force, I do not do physical therapy in my office, but I definitely have had cases that I have referred for physical therapy. And we'll go this way.
John Klingborg, small animal veterinarian in Merced, California, also chair of the Multidisciplinary Advisory Committee, which is an advisory committee to the Veterinary Medical Board.
Bill Gage, I'm a chief consultant for the Senate Business, Professions, and Economic Development Committee.
Leandra Clark Harvey, chief consultant, Assembly Committee on Business and Professions.
Valerie Fenstermaker, I'm the executive director of the California Veterinary Medical Association.
Spring Holland, veterinarian. I work at Western University.
Janet Van Dyke, a small animal surgeon. I represent Canine Rehabilitation Institute.
Karen Atlas, I am a physical therapist with certification in canine rehab, and I am representing the California Association of Animal Physical Therapists.
Dr. James Sims, representing the California Physical Therapy Association and assistant professor physical therapy at Loma Linda University.
I'm Carrie Ann Calais, and I am a consumer of veterinary services.
Erin Troy, I'm a small animal veterinarian and a certified animal rehabilitation therapist, and I'm certified in veterinary pain.
Kristen Hagler, I'm a registered veterinary technician, and I'm also certified in canine rehabilitation and pain management. I represent the Academy of Veterinary Physical Rehabilitation Veterinary Technicians proposed to NAVTA.
I'm Jessica Waldman. I'm a veterinarian certified in both acupuncture rehabilitation, and I operate a only animal rehabilitation practice in Los Angeles.
My name is Shala Barr. I have several certifications in massage and body work for animals and humans. I'm also certified in canine conditioning and fitness training, and I'm also a consumer.
Lee Heller, I'm a public member of the Veterinary Medical Board, a longtime animal advocate, and I live in that place where people go when they flee Hollywood, Santa Barbara.
Sure.
Anne Marie Delmanayo, the Executive Officer for the Veterinary Medical Board, and to my right is Kurt Hepler, who is Board Counsel.
And just a point of clarification, they are not members of the task force. At this point, would any members of the audience like to introduce themselves? Okay, welcome. I would like to thank all the task force members for all the hard work that you've put into this task force, as evident by the sheer volume of material that I'm sure everyone has had the opportunity to go through. I don't think they investigated the incident of what happened in Benghazi as thoroughly as we've investigated rehabilitation. I would like to thank Bill Gage for getting us this hearing room. It's fabulous. Thank you. And I'd also like to just do a special thank you to Karen Atlas. I think you did a tremendous amount of work for the task force. It definitely reflects your dedication to your field and your willingness to work with this task force to get it done right. So thank you, everyone. I'm going to make a very quick change to the agenda. I think it just will flow a little bit better. And we're going to switch items 7 and 8. So 8 will be 7 and 7 will be 8. Also, I would remind the task force members that this is our last meeting. So we have to get a recommendation out today because we will not have an opportunity to schedule another meeting. The legislator asked the recommendation to be made at the January Veterinary Medical Board meeting. That doesn't mean that the issue will be done. There certainly will be other opportunities for public members, including task force members, to weigh in as this whole thing goes through the process, like a sausage factory. It'll go to regulatory hearings and legislative hearings and so forth. So hopefully we'll get something clear put out. The other thing I'd like to mention is when we get down to item 9, it's probably going to be nearing the end of the day. The issues of supervision and practice settings, I think, is going to be most paramount, and definitely we will be talking about that. Those other issues of licensing, enforcement, discipline, outreach, and so forth, if we don't get an opportunity to cover all that, that definitely falls under the category of ways and means of how to implement the recommendations that we've come up with. So let's not stress if we don't get all those details covered. And to conclude my opening remarks, as we deliberate the issue and refer back to the information that we received and listen to the views of our fellow task force members, the illustrious Ted Cruz advised delegates at the Republican convention to vote your conscience. But I not only implore you to do that, but also remember what is best for the animal patients in this state and also what's best for the consumers. I'd also specifically like to remind Kurt that consumer protection is paramount. And I say that because he always tells that to us. So the item number 3, review and approve the Animal Rehabilitation Task Force meeting minutes. And that's actually agenda item number 32 on your hyperlink page. And the order of the hyperlinks makes absolutely no sense, but it is what it is. I think it was put there as they were received, not necessarily categorized. So
Yeah, it's
38 are the minutes from last meeting. Are there any corrections or additions to the minutes? Yes, Karen.
I just have some minor corrections. If you could just add my credentials for the licensed professional stakeholders on there, and it would be PT, MPT, and then my comments.
Hold on, I'm sorry, you said what?
Sure. PT, MPT.
Thank you.
And then page 7, it said that PT has a specialty certification. It's you can take out the neuro part of that. It's just EMG, electromyography.
Okay.
Yeah.
Dr. Sims?
Yeah, my name is spelled correctly in the cover sheet, the first page, but in the body of the minutes, it's spelled differently. It's phonetically written. It's SYMS.
Okay, we'll make the changes.
Yeah, it's just a courtesy edit, more just clerical.
Hearing no other corrections, or do I have a motion to accept the meeting minutes?
Hi. Page 3, in the middle, right after Mr. Hepler explained how the Practice Act, and then Dr. Sims addressed the use of the term physical therapy, I voiced my concern that changing from animal physical therapy to animal rehabilitation would be confusing for consumers. I think that's important because I know from my own professional field, which is art restoration, that we have gone through for several decades a similar situation in which the powers that be wanted to change from being called restorers to conservators. People still, after I've been a restorer, I've been a conservator for 30 some years, and people still don't know what that means.
Yeah, so could you just briefly summarize what you would like?
What I would like to say is that that a change from the
You had made a statement saying that it's important for the consumer to know.
Well, that having a change from physical therapy to animal rehabilitation can be confusing for the consumer. They might take a very long time to absorb what the meaning of that change might be.
Okay, yeah. So we're not in a discussion. We just want to make sure that the minutes reflect.
But that is
what you said.
that is what I
That's
said.
We'll add.
Motion to approve the minutes.
Seconded.
It's been motioned and seconded. Do we have to go the roll call? Or?
Yes, Mr. Chairman.
All right. So roll call for the vote, please.
Dr. Nunez?
Yes.
Lee Heller?
Yes.
Dr. Klingborg?
Yes.
Karen Atlas?
Yes.
Sandy Gregory? Kristen Hagler? Dr. Holland?
Yes.
Dr. Schluchter? Dr. Sims?
Aye.
Dr. Troy? Dr. Van Dyke?
Yes.
Dr. Waldman?
Yes.
Dr. Chow? Chalet Barr?
Shala.
Sorry about that.
Yes.
Bill Gage? Carrie Ann Calais? Valerie Fenstermaker?
Yes.
And Leandra Clark.
Yes.
Okay, moving on to item number 4, which is public comments on items not on the agenda. So if you have a comment on an item that's already on the agenda, you will have an opportunity to do so. but if there's anything not on the agenda that a member of the public would like to bring forward, now is your opportunity. Okay. Would you mind approaching one of these microphones and press the button? And as she approaches, I'd like to remind the task force members that you don't have to respond to the public comments because, again, these items are not on the agenda, and so legally we can't talk about them or discuss them. But I would definitely advise members to listen attentively and take any public comments into considerations during your deliberations today. And if you could introduce yourself and...
Sure. My name's Rebecca Dewar. I'm a veterinarian and PhD in animal physiology. I have previously written comments last September and did oral comments at the last September meeting. I am a wildlife rehabilitation veterinarian, and I and the State Department of Fish and Wildlife, who's also made comments to you, do not feel like our concerns have been adequately covered yet, and Grant Miller thought I should come up today and mention that to you. There is an issue with the labeling of animal rehabilitation with overlap with our field, and we would really like it if you would resolve that conflict. It could be as simple as a sentence exclusion into whatever regulation you end up writing. So thank you very much.
Did you provide some material too?
I did not make any written comments this time.
We did receive a letter from you actually yesterday in the office.
That was probably from Nicole Carrion.
Terminology, right, from Wildlife, Fish and Game. So that's something when we get to the regulatory phase of this, that would be addressed. It's not necessarily something during the task force meeting where we're not really looking at exact language that will either be formulated statutorily or from a regulatory perspective. But the conflict in the CC&Rs is something we'd have to address by regulation.
Okay.
So thank you for the comment.
Okay, thank you.
Did you just respond to a public comment? Not on the agenda?
It's administrative. It wasn't content response.
I'll consider that strike one.
So if I get in trouble, two more things, I have to leave.
Yes. Any other comments from the public? All right. Hearing none, then we will move on to agenda item number 5. And I will hand this over to Anne Marie. What we've accomplished so far.
Okay, so we'll make this short and sweet. You have in your materials online a nomenclature document. That's item number 2 in the list of online links. And essentially that reflects the agreement of the task force from the meeting of June 20th. We decided on the definition of animal physical rehabilitation. We actually decided on what it does not include, that being relaxation, recreational or wellness modalities, including but not limited to massage and athletic training or exercise. We also added a provision that this does not intend to restrict or amend Section 2038 of the California Code of Regulations regarding musculoskeletal manipulation modalities. The very last policy decision of the Animal Physical Rehabilitation Task Force was that this would all be done once a valid veterinary client-patient relationship is established by a veterinarian, and we reference the code sections in the California Code of Regulations 2032.1 and 2032.15. There was one outstanding or remaining issue that we did not take a vote on, and that was the actual name of the practice. It's reflected here in all of these policy decisions. However, we did not have a formal vote changing the name from animal rehabilitation to animal physical rehabilitation. So I would invite the committee at some point, if they want to make that formal recommendation and change, that we call for a vote.
So if you recall, the title of the service provision that we talked about was animal physical rehabilitation, but we did not officially vote on it because Lee suggested that we defined the title before we vote on the title. We have defined the title, and we voted and accepted it. So the only thing that needs to be voted on is the title that we agreed upon. So if there's any questions about that, then if there's not any questions about that, then I would ask for a motion to accept the title of the provision that we discussed last meeting.
Chair Nunez, as the troublemaker in question, I would like to move that we accept the title of Animal Physical Rehabilitation.
Second.
It's been motioned and seconded. That was easy. Are there any questions or comments from members of the task force? And are there any? Oh.
Is there a possibility that people who are currently physical therapists or certified animal physical therapists, will they be able to continue on with that certification especially for public consumption, public identification? Or will they have to change? Will the academic titles, licensure have to change?
Yeah, I think that's going to be covered in the body of our recommendation of what they can do. What we're just voting on right now is just the title of the provision of the regulations that we're forming.
It's basically the title of the practice itself in California. As far as what certifications are issued either from a state or national, we don't have the authority to change the title of a certification that's issued from a certification body. So they will still have to use whatever certification title. However, as we move forward with formulating the kind of administrative aspects of how you're overseeing or regulating this practice, there may be a need for them to identify themselves as animal rehabilitation therapists, but the certifications that they earn, those are certifications in and of themselves, and the board wouldn't have the authority to change the title of those certifications.
Okay, thanks.
Any other questions from the task force members? Any questions or comments from members of the public? Then we shall call for a vote, please.
Dr. Nunez.
Yes.
Lee Heller.
Yes.
Dr. Klingborg.
Aye.
Karen Atlas. Aye. Sandy Gregory. Kristen Hagler. Dr. Holland.
Yes.
Dr. Schlachter. Dr. Sims.
Aye.
Dr. Troy. Yes. Dr. Van Dyke.
Aye.
Dr. Waldman. Yes. Dr. Chow. Shala Bar.
Yes.
Bill Gage.
Aye.
Carrie Ann Colley.
Yes.
Valerie Fenstermaker.
Aye.
Leandra Clark Harvey.
Aye.
Okay.
Sorry about that. Okay, I got you.
Okay, then moving on to agenda item number 6, which is scope of practice of veterinarians, registered veterinary technicians, veterinary assistants, and physical therapists. The scope of practice was discussed at the last meeting that we have. It was discussed that animal physical therapy, animal rehabilitation is within the scope of practice of veterinary medicine for veterinarians. RVTs and veterinary assistants may provide therapy under the supervision of a veterinarian. And what I would ask the task force members to consider, we are going to have a very intensive discussion about supervision and levels of education and training. But I would suggest or offer that discussion comes at a later agenda item. What I'd like to focus on item 6 is scope of practice. So the California Veterinary Medical Practice Act supports the statement that animal rehabilitation is within the scope of practice for veterinarians, as it states that a person practices veterinary medicine, surgery, and dentistry, and the various branches thereof, when he or she does any of the following: A, represents himself or herself as engaged in the practice of veterinary medicine, veterinary surgery, or dentistry in any of its branches, and B, diagnoses or prescribes a drug, medicine, appliance, or, and here's the important part, treatment of whatever nature for the prevention, cure, or relief of a wound, fracture, bodily injury, or disease of animals. So it's within the scope of practice for a veterinarian to do so. I consider RVTs and veterinary assistants as members of the veterinary team. So in order for a veterinarian to practice medicine, they have to have a team to perform the task. In other words, if a veterinarian orders a blood test, the task of drawing that blood sample needs to be done. Physical therapy would be in the same way. If we have a diagnosis and a prescription for physical therapy, it's going to be carried out by a veterinary team. So hopefully that makes sense, how it falls within the scope of practice for veterinary medicine. And again, the discussions on who can do what and what education and training and so forth that they will need and supervision and so forth will be discovered in a lower agenda item. Yes.
I just want to make sure that we clarify what agenda item that's going to be covered in.
The one where it says discussion of educational and training requirements.
Okay.
Yeah. The next item on scope of practice is physical therapy, animal rehabilitation within the scope of practice for physical therapists. And currently, as it stands, there is no authority in the California Physical Therapy Practice Act for them to practice on animals. Doesn't mean that the discussion is ended. It's just that's where we are right now. So, does anyone have any questions or comments on scope of practice, this agenda item?
Only in so much that Mr. Hepler pointed out last time that the Practice Act can be amended to actually exclude some aspects of veterinary medicine from licensure. So that is a possibility as well. And so I just wanted to point that out as it being a possibility. And that physical therapy can also be, have an inclusion into the Practice Act, or actually it would be an exclusion to allow physical therapists to practice veterinary physical therapy.
Yes. Yeah. And what Karen is referring to is the memo that Kurt had sent to the task force. And if Kurt would like to add to this, what Kurt was discussing, that it's common for scope of practices to be expanded by requiring certain additional education or training, and you can expand on this in a bit. He also said that it is uncommon but not impossible to make the scope of practice smaller by requiring a licensee to obtain education and training on something that they are already licensed to do. So Kurt, I'm going to have you just kind of expand on that.
Certainly, thank you. Ms. Atlas is absolutely correct. It certainly is within the purview of this, I would say, I'll just say the body, to recommend whatever it wants to recommend. If it feels like the PT scope of practice should be expanded and the veterinarians scope of practice be constricted, it can certainly recommend that. Dr. Nunez, having served with the medical board, the PT board, and other boards that are too numerous to mention, I would say that is sort of unusual because most boards issue what they call a plenary license. The medical board issues the physician's and surgeon certificate, and you get to do all things medicine. Some of the other boards essentially have a baseline like optometry, that have a baseline licensure, and then with more certifications, with more training, you get to do more things: glaucoma, TPL, TPA, DPA, sort of that in the optometry world. So my comments are not directed as to be a limitation to this body. It's just, in my experience, it's been unusual. But again, the reason we're here is to make a recommendation to the board and then ultimately to the legislature. So that is totally within the board's want, within the task force's want.
So my feeling that agenda item number 6 was to kind of review what the understanding of scope of practice is and the options that this task force has in making its recommendations. I don't necessarily think we need to make a motion or start to work on the recommendation at this item unless anyone disagrees. So does anyone have any comments or motions or questions at this point?
Can I offer what I hope will be a helpful clarification? Because I do think there's no motion to make at this point because we don't know yet what we're ready to recommend about any potential changes to the scope of practice. When I first became aware of this issue, I didn't understand the Practice Act because I hadn't read it, and the breadth of the scope of practice as it's currently defined in the state of California. And I think it's really important for the non-veterinarians, because the vets obviously already know what their Practice Act covers, as do the RVTs, that as currently written, and again, that doesn't mean we are prevented from recommending changes, whether regulatorily or statutorily, the scope of practice for veterinarians is extremely broad. As I've been putting it, you know, a veterinarian can do neurosurgery on a whale, basically. Obviously, a responsible veterinarian would not engage in practice that that person did not feel competent to perform. But I think the general public might not understand this. So that in the state of California right now, anything that falls under the definition that Dr. Nunez offered would be considered within the purview of any licensed veterinarian. And I just hope that's helpful to people who might not understand that, because then we would have to have the discussion about this notion of suddenly asking veterinarians to have additional training for one specific area, which would be a new direction to take. Is that helpful?
Kristen?
I would just like to add in to your comment with the veterinarians that the RVT healthcare task list also would be encompassed with that the general public is often very uninformed on what healthcare tasks the RVTs are allowed to do in the state of California.
Okay. I'm wondering if it's possible to look at not limiting or excluding veterinarians or excluding or exempting physical therapists, but to acknowledge in some way that there is a shared body of knowledge and skills that physical therapists and veterinarians must share, to look forward to more of a collegial atmosphere. It's just a different angle on the whole thing.
The other comment that I guess I would like to make is when we're considering the scope of practice, yes, veterinarians do have a wide scope of what they can do, but at the same time, the Veterinary Medical Board provides the opportunity of recourse if it's not done correctly. And so if somebody's doing something that they really don't know how to do, then sooner or later, they're going to be made to not do that. That's also, I know our Veterinary Practice Act is very long and due process is very long, but there's a reason why it's all there.
There's 2 points I want to make, and one is generally, as she brought up, for moral and ethical purposes, just because one can do something doesn't mean that one should. And I know the Practice Act, I'm not about to take that on. I know that's it is very broad. And the comment that you made is valid, that if somebody's doing something they shouldn't do, eventually they'll stop. But what kind of damage is committed in the meantime? And we are here to prevent consumers from having to endure that kind of damage to their pets. So that's kind of closing the barn door after the horse got out. So I feel as though asking people who are trained in this field to not do the work, but having people who are not trained in it be able to do it is hypocritical. And I think it's contrary to what we're doing here, which is trying to create consumer protection.
In clarifying the scope of practice and kind of the boundaries in which veterinarians work, I want to remind the lay public that we've gone to college for at least 8 years to get this license, and most of us don't have a backup plan. Being a veterinarian is who we are. And the Veterinary Practice Act has a section 4883, which does discuss unprofessional conduct, fraud, deception, incompetence, and negligence. And we have a number of disciplinary actions that may be levied against us as veterinarians if we have practice outside our scope. For example, if I did neurosurgery on that whale as a small animal veterinarian, it would certainly be outside my scope. And that would include suspension of my license, revocation, cite and fine, cease and desist. So I understand what you're saying, Shala, about the horse getting out of the barn, but there's a significant amount of pressure on veterinarians to behave within not just what is the written scope of practice, but within what they understand as their technical and educational abilities. So it's there. And I don't think that we see that abused as often as people would fear.
Karen?
I would just like to echo Shala's comments and add that that though the veterinary scope of practice is very broad, that I think once we dive into the curriculum of the veterinarians and look at what is taught, then that will help us better understand what is expected to be learned and be able to demonstrate competency therein.
Dr. Sims?
Yeah, I echo Dr. Klingborn's comments, and then I think that the licensed practitioner of healthcare in the state of California has the same kind of oversight of them in terms of the physical therapists also working within their competency. They may be legally allowed to, but are they competent? There's a difference between legal and competence and stuff like that. I also agree, and I'd like to comment in terms of this collegial kind of activity relationship, a non-hierarchical event in terms of, and that's the drive for this committee is for consumer protections, not a special interest group protection or income stream protection kind of event. What is the best for the consumer and who's a trained practitioner that could add to that health care of that vertebrate, whether it be a canine, equine, feline, whatever it might be, with the additional qualifications as you go from there. Physical therapists, in no other aspects of our practice are we supervised by any other doctoring profession. We are autonomous practitioners, but we are not independent practitioners. I've seen comments and information come across regarding the scopes that addresses the model of supervision and activities, and I think that if we look at really and stay true to the task of this committee of consumer protection, what's the best for the health care of that entity, that we it makes our job maybe a little bit easier, I hope.
Shala?
I just want to point out also, we were all in agreement the last time we met that animal physical rehabilitation is a specialized field, and we all learned that it's not a field that's taught in veterinary school or vet tech school. And I think it's contradictory again, and it's hypocritical to be saying a vet is trained in a wide scope of areas, therefore they're allowed to do this very specialized field. And I know that addresses the point of specialized training and requirement, but I think it does speak to scope of practice very clearly and loudly.
Dr. Troy?
I'd just like to clarify a couple of points, Shala, because much of what you say I do agree with, but rehabilitation type therapies are taught in veterinary schools. They are taught in technician schools. They exist in books, in textbooks, in curriculum program. They're not as well founded as cardiology. They're not as well founded as dermatology, but they are widespread. And all the veterinarians and the technicians are now getting very good exposure to it.
Yes, and I promise you, we're definitely going to cover extensively the issue of training and education. I hope that on this item, again, we just understand the scope of practice and what that means and where it currently is in California. Carrie?
Well, from the consumer side, I would like to just make a remark about the converse situation, that so far people have commented on the need to train veterinarians and educate vet techs, et cetera, on animal physical rehabilitation. But I very seldom have read or heard comments that consumers can learn to know that physical therapists, animal physical therapists, can be educated as to veterinary medical knowledge and participate in the converse direction, that physical therapists can learn about animals, and they should learn about animals in the same way that you might expect a veterinarian to learn about physical therapy from the day they graduate, or the training that they receive in vet school. So I hope that makes any sense.
Yeah.
That it goes both ways.
It does. I think you raise a valid point that it does go both ways in assuring that both sides do have the adequate training and education. And I think also that point brings forward the outreach that any regulatory body has to make the consumer aware of what a veterinarian does and what a physical therapist does. That definitely addresses outreach too.
Can I just make one more sentence? Is that as a consumer, I would look for certifications, look for initials after someone's name, and I would never expect to leave my animal in the care of somebody who hadn't had animal physical rehabilitation training. I would never leave my animal with a plain old physical therapist because duh. Thank you.
Shala?
I want to address what Carrie Ann said. Physical therapists who are working with animals are required to receive training in animal physical rehabilitation. And correct me if I'm wrong, I do know that the training is out there for vets and for vet techs, but I believe it's an additional training. I don't think it's in with, it is in all core curriculums now. Okay. Yeah, right.
Mr. President.
Dr. Holland can speak.
If I may, I think that was me jumping again to item number 7, which is, or the new 7 or the new 8, sorry, not that good at math, about what everybody learns. So it would be, as your legal counsel, why don't we conclude, if there's no more discussion, pending public comment on number 6, and then since there seems to be a great deal of interest in who learns what during their collegiate or post-secondary career, why don't we tackle that issue after we see if there's any public comment as we close this one?
I tried to warn you guys. Education's going to be covered, and Kirk has a thing for agenda items. If we talk out of agenda, then Kirk will get mad. So again, any additional comments or questions from the task force on the item of scope of practice?
I am wondering, because there is so much interest, I know you had played agenda item musical chairs, maybe we should unmove that one and go straight to education training so that we can correct any misunderstandings about the kind of training that people receive.
I appreciate your suggestion, but I researched this before. Changing the order of the agenda is my authority, and I don't need your approval.
Just a suggestion.
And there's a reason, Alex, there's a reason for that. I hope I will make clear. Hearing no other additional questions.
I just wanted to correct any misapprehension. I did intend to say that the back and forth flow, I meant to be talking about the scope of practice, to insert that into the idea of the scope of practice. Thank you.
Any additional questions or comments from members of the public? Could you identify yourself, please?
Grant Miller. So will we be given the opportunity to address some of the comments that were recently made, or should we try to address those now?
I think you should address it now.
Only as to the scope of practice.
Scope of practice. Remember, education is later.
Education is next on the list, or close to next on the list.
So Grant Miller, I'm an equine practitioner, and actually I wanted to make a direct comment to two of Ms. Barr's comments. So whether their scope of practice, whether their education, I don't know. But there were two things that she mentioned, one of which was that the task force had agreed during the last session that animal rehabilitation was a specialized field. I do not recall that agreement being made with this task force. It certainly wasn't reflected in the 4 items that Ms. Del Munayo reported on. And so I really want to be careful about, a cadence or a rhythm tending towards that. That is not something that I observed. The second thing is that she had just mentioned that animal physical therapists have to have certification or special training to work on animals. I do not believe that is true. I believe that currently the physical therapists who are working on animals are doing so illegally because their license only allows them to work on human beings. And so I don't believe that anything has been set out, and forgive me, I'm not an expert on the Physical Therapy Act, but I don't believe that anything has been set out in that act which allows them to work on animals provided they have a certification. Thank you.
Just one second. Any other additional comments from the public? Yes? Yeah, and I think we talked about that when we were talking about outreach. Once we come up with a recommendation, it is important that the consumer knows who can do what and who can't, and that's part of outreach that every board does with their fields. I think we had an additional comment from Dr. Waldman.
Just relating to the last public comment, physical therapists, this is the way I interpret it, but I'm hoping the other people here will help me interpret this properly, but they're not illegally practicing currently. They are just considered unlicensed assistants. So they are practicing. In fact, my practice has 4 full-time veterinarians and 4 full-time physical therapists. So they are practicing. We're complying under the direct supervision that currently exists that we're all discussing today. And they all practice every day, all day long, doing animal physical rehabilitation, and we're complying. So it's just, I think, if they were to do it on their own, meaning without a veterinarian, where that's when the questions seem to fall into place.
Yes.
It does get complicated, but if animal physical rehabilitation is the practice of veterinary medicine, and the practice of veterinary medicine needs to occur in a veterinary premise, then obviously if individuals are doing that outside of a veterinary premise, then that is illegal. If individuals are doing that and they are not directly linked with the veterinarian, and that is, I cannot as a veterinarian refer a case for animal physical therapy to somebody who is not also a veterinarian, because you cannot refer to somebody unless they have that license. I may consult with somebody who's not a veterinarian, but I also am not going to consult in a way. A consultative relationship is not one where that animal goes elsewhere, gets some form of therapy, and then comes back to me. So there, again, needs to be on a premise, needs to be some level of supervision, which we're trying to sort out at this point. Within your setting, your physical therapists are absolutely within the letter of the law. They are, because we don't have the word physical therapist in our Practice Act, they are viewed as veterinary assistants.
These are all excellent comments that are being made. I know there's so many pieces to this puzzle. If members of the public or members of the viewing audience missed episode 1, I would recommend that you stop right now, go back and watch episode 1, and you'll be caught up, because it's complicated. Yeah. Any other? Val?
I just wanted to address her question quickly, and this is no different than when we go to our own doctor or dentist. A veterinarian has a doctorate, falls in the same category. The consumer has to ask questions, and a veterinarian with that degree is entitled to treat animals. So that hopefully helps.
Any other? Okay. I think that we have covered agenda item number 6, and moving on to the agenda item previously known as 8, which is now 7. Discussion of animal rehabilitation program models in other states. And I'll explain why I changed the order. I think we're all in agreement that that last item is really where the heavy discussion is going to be had in today's task force. And I think it would be helpful at the last meeting, if you recall, Anne-Marie and I were going to be attending a meeting of the American Association of Veterinary State Boards, AAVSB, which we did, just to get more information about what's happening around the country and in other states. And also, in your package, in no order whatsoever, are examples from other states of what they have done with physical therapy in their states. And there's also a map that kind of tries to illustrate what the current state is. And the reason why I did so is just to give task force members more information before we really dive into the issue. And if there's any practice model that in some way remotely approaches of what direction we want to go, we can perhaps use it as a springboard. But if we don't think it closely resembles it at all, then we can do whatever we want. So I'm going to turn it over to Anne-Marie to give a recap of what we learned in Scottsdale.
Okay. I actually serve on an executive directors committee of the American Association of Veterinary State Boards. And as a committee member, I asked that animal physical rehabilitation be placed on an agenda. There were at least 28 executive directors represented at the executive directors meeting. So these are not board members. These are not active market participants, as they more fondly have been called these days. These are executive directors / administrators that are meeting together to talk about regulatory issues specifically. So there were no practitioners in the room that I'm aware of. Interestingly enough, other states did not report having issues on how their respective laws or regulations govern animal physical rehabilitation, including states with indirect supervision or those that require direct supervision and those that require referral. There was also no reported public demand for access to services as reported by these executive directors. The Nevada executive director did report that the oversight in Nevada, which has been in place since 2004, where the Veterinary Medical Board registers physical therapists to provide animal rehabilitation works very well. The Veterinary Board in Nevada worked with the PT Board to allow the use of the term animal physical therapy. So that title protection in Nevada was negotiated, and they used the term animal physical therapy in Nevada. However, the veterinarian must first establish the veterinary client-patient relationship, determines that the animal is in fact a candidate for physical therapy, and the physical therapist must provide all of the records to the veterinarian. RVTs in the state of Nevada must work in an animal hospital setting to provide animal physical therapy, whereas PTs can work outside a veterinary office. There has been one complaint filed against a PT and the referring veterinarian regarding animal rehabilitation. However, to date, there was no disciplinary action pending at this point. All states reported that the practice of animal physical therapy, or animal physical rehabilitation, as it may be called in their state, is within the practice of veterinary medicine. No state requires advanced training or certification beyond the doctorate of veterinary medicine for licensed veterinarians. And then there are various degrees of requirements for hours for non-veterinarians to practice animal physical therapy or animal physical rehabilitation.
Are there any comments or questions from task force members? I'd also like to ask, in the package, there's also some survey information that Karen Atlas had provided in regards to reaching out to state boards in the area of complaints.
Yes,
you found.
correct. So I reached out to the states that had indirect supervision models and contacted their state board authorities to ask about whether there were any complaints or disciplinary actions against physical therapists with advanced training that practice in those states. And they did, the ones that reported back, I have it listed in our packet, said that there have been no complaints of any kind of these practitioners practicing. So I think that there has been a lot of discussion in the past about potential for harm for advanced trained physical therapists to practice in an indirect supervision model. So I wanted to seek out whether harm has been made, and according to these board authorities, an aggregate of 72 or 73 years, over the aggregate of 72 or 73 years, there have been no complaints against physical therapists practicing in an indirect supervision model. So I think that is clearly enough time to show that there has not been any, it has not been a significant problem in terms of demonstrating harm to the public to allow these types of practitioners to practice in an indirect supervision model.
Karen, did you by any chance ask how many individuals in these states practice veterinary medicine as physical therapists? I know in Nevada it's maybe 7 or 8 people. In Colorado, I don't know. I think they somewhere reported less than 20.
I don't know. I don't know how many are in. I just know from you saying the 7 or 8 in Nevada. And Nebraska is really new, but that was only a year's worth anyway. So I don't think that there's too many there. But I know Colorado is particularly flourishing industry there, and there hasn't been any problems with their model.
I think it's fair, though, that we keep in mind when we're not talking about 10 to 15,000 practitioners. We're talking about maybe a handful. So again, complaint data, when we're talking about such a very small select population, may be hard to extract a lot of good data because it's such a very small sample. I don't know from all the other states how many. I just know from the EDs that I talked to at the meeting, there's very few that practice in the specialty field of physical therapy on animals.
Yeah, I can't speak to how many there are. I can just speak to the vast amount of years, of 70 plus years of no complaints. So
I also, oh, sorry.
Dr. Choi.
First of all, Karen, I think it's great to have those numbers. I think it's, and I appreciate all the time and effort you put into collecting them. I think one of the things that a lot of people don't understand is that the public doesn't always know when their pet has been harmed. Harm does not mean death. People know when their pets died, but they don't always know if their pet's been harmed. And harm does not always be proactive. Sometimes it's the lack of activity. It's the lack of intervention. I think those of us that have practiced in the veterinary world could speak off the record of incidences that we've been made aware of second or third hand of what we might interpret, I'm not an attorney, but might interpret as negligence, where the clients have not reported it, either by lack of knowledge, they don't know what to do, they don't have the energy, emotional or otherwise, to report it, or they don't know that there's an entity where to go. They just want to put it behind them. So while I would love to think that there are no pets being harmed by anyone out there, I don't think the lack of reporting means that there are pets going without being harmed. And I think that the numbers involved are skewed, and I think that we need to keep in mind that, because you made a comment that had me a little bit concerned about potential for harm, and I think there's always potential for harm. I can cause harm. So I think that we need to take out the potential for harm as being an issue, because I do believe it exists, and I think that's one of the things we'll talk about as we go forward. But I have had clients bring situations to me that they have described to me third and fourth hand that, in my opinion, should probably be brought somewhere else other than me, and they've chosen not to do so.
Doctor, not a veterinarian or a physical therapist, Heller.
I am suitably chastened. I'm a little bit leery of each of us trying to undermine facts as other people bring them forward. I think Dr. Troy's points are excellent. Anybody can cause harm in any profession, but I think it is also noteworthy if there is not evidence of harm at the level of complaint, because people do file complaints. I'm on the Veterinary Medical Board. I read them, and I wish more people would. Because I think it's the mechanism we use to ensure that practices are properly performed by professionals. But I also think that in a world where there aren't very many physical therapists practicing on animals in a approved setting, like, for example, Colorado, Nevada, people who are going to those practices are seeking them out, are probably more educated than the average consumer to begin with. I know that I am, and would probably, and again, I'm extrapolating just the way that you are, so having said not to do it, I'm doing it, would be more likely both to recognize harm and would be returning to their veterinarian if there were a problem. And the veterinarian could be in a position to say, this didn't go well, and more likely to seek it out. So let's not assume either thing and just note the facts, maybe.
I'll have Shala and then Dr. Waldman.
I want to speak to several points. I think 70 years with no harm, whether you know how many practitioners there were or not, I think is notable. I think it's true what you're saying, that anybody can cause harm. Taking information third and fourth hand, I think, is like playing telephone. You don't really know, so I don't think that, unless that's investigated personally or you have some facts on that, I think it's all hearsay. There's also the point that I think people are missing, that there are a lot of people out there practicing who are trained to practice who are not causing harm. So you have no complaints against how many compliments, and we're not discussing that, how many people have had successful outcomes with someone who was a physical therapist, a licensed physical therapist working with an animal, and there was a successful outcome. We don't hear about that ever. We only hear about the complaints, and we're not hearing any. So I think that speaks volumes about the responsibility of the people who are doing the work. And I do know of a vet who's caused harm 3 times, and nobody took action against them, and they are trained in physical therapy. So, you know, it can go either way.
Dr. Waldman and then Carrie.
I think that Dr. Troy isn't just saying that anyone can do harm. We all know that. I think she's saying what you just said, Shalot, which was that oftentimes we see harm and we see harm as veterinarians, and we see it's not reported. And if you're talking about first, second, or third hand, I am a referral clinic. Other veterinary clinics refer to me. I look at every single medical record. I look at every single x-ray and MRI and every report, and I can see when there may have been harm done or negligence along the way. So it happens, and I can see that owners don't complain. And I just want to tell one anecdote that came to me 5 days ago, which is that, as you know, I work with physical therapists certified in animal rehab, as well as veterinarians certified in animal rehab. One of the physical therapists that I used to work with recently opened about 2 months ago a rehab clinic in Southern California. A veterinarian whose own dog had a hip surgery came to our clinic and said, "What do you think about this other place?" And I said, "I'm not sure if they always have veterinarians there or not, so I'm kind of on the fence about it. I know that person is competent." That physical therapist, she said, "Well, I have had a bad experience with them already. Prior to them opening, which was about a month ago, the physical therapist, or the team, which was a physical therapist licensed in animal rehab or certified, went to the pet's house. It was a geriatric German Shepherd, the veterinarian told me, and continued to get worse and worse mobility and comfort. And the physical therapist repeatedly said, we need to keep working at it, and we can do it, and we can keep trying. And the veterinarian looked at me and said, my biggest problem with this is that this person was really giving my client false hope. And as the pet worsened and worsened, the client came back to the clinic. Then the veterinarian, who was my client, examined the pet and found a grapefruit-sized bone tumor that the physical therapist did not see. And I don't know how many examples of this I want to give or I can give after doing this practice for 11 years and how valuable I find physical therapists, because I do. But that's not fair. And that's not about education. And I'm not saying that physical therapists aren't amazing at what they do, because they are. But to me, that's what it's about. Is that consumer protection for that lady? Was that best for the pet?
Okay. I'm going to go to Carrie Ann next, but
I'm sorry, Mr. Chairman, if I may, I'm going to have to interrupt. So the item agenda we're on is information from other states. And so speculation, conjecture, even anecdotal evidence, to me is a little bit, it's not a little bit, it's a little bit off topic. I think Ms. Atlas has done a Herculean job of providing information from other states. We're not on trial here, but I think each individual task force member needs to weigh that and the import as they make the decision. We have factual data. It has some limitations. Not everybody files the complaint. We may have a small sample data, but again, it's fact. Maybe it needs to be discounted a little bit or weighed a little less heavily. I'm very concerned that we're straying off the agenda and talking about onesies and twosies and things, because I'm sure we all have stories. I could tell you stories about my own health care that went awry. I'm not sure that it's relevant here. Talking about hearsay and speculation and conjecture, I would just ask the task force as it proceeds that it stay on agenda item 8, which is the models in other states, and then 8A, which is the information that I think was provided by the executive officer.
Okay. Again, I warned you guys he had a thing for agenda items. Anne-Marie gave me some essential oils that was stress relief before the meeting starts. Did you give some to Kurt? Okay. It's too late.
Can I have some too?
I'm going to go to Carrie Ann next, but I'm going to press pause real quick because Dr. Chow has entered the meeting. We're just about wrapping up here, but if you'd like to introduce yourself and tell us where you're from and who you represent.
I'm Paul Yan Chow. I'm representing UC Davis. I'm a small animal orthopedic surgeon. Sorry, I didn't know where we were here. But from what I've heard over the last 4 minutes, they're all very valid points. And
I just wanted you to introduce yourself.
Yeah, that's good. They're all valid.
Unpause. Carrie Ann.
The comment I was going to make really would probably be better talking about supervision and incidences of why supervision may or may not be needed. But as long as we're talking about state models, I gave a little one-page handout through Ms. Del Muñayo to everyone about the Illinois model, which as I've learned about the Colorado and Nevada models, I feel that they're really excellent. But in terms of collegiality and sharing and developing relationships, I think that the Illinois model is really wonderful because the foundation of it is respect for the other licensed boards and their licensees in the state. And though it is outside of the scope of the Animal Physical Rehabilitation Task Force to talk about wellness practitioners, et cetera, that is actually has been incorporated very gracefully into the Illinois Veterinary Practice Act. So I just cite those passages in the law and what I think provisions that could be hung on to those, they're currently exemptions from veterinary practice, just as something for everybody to contemplate. So much for, state models. Thank you.
Lee?
That's Ms. Heller to you, buddy. I wonder if I can just sort of take a slightly different tack while staying on this topic, because one of the things I've really been eager for is information, just to know what's out there and how it's being handled. And I assume the point of this agenda item is to help us to know what kind of models are out there, both direct supervision models and indirect supervision models. The direct are more straightforward because they're the model we're already pretty much familiar with. And as Dr. Wallman points out, that she's already operating under, so that the physical therapists at her practice are effectively unlicensed assistants, since they don't qualify as RVTs. And under our Practice Act, we have veterinarians, RVTs, and unlicensed assistants. The indirect models offer us some different possibilities if we go that route. So Nevada, if I understand right, supervises qualified physical therapists with additional training, both under their PT and their veterinary boards. And please correct me if I'm describing that wrong. Colorado's practitioners are supervised by their physical therapy board, is that right? But have to have additional training. And it might be that Dr. Van Dyke, who's been very quiet, might be able to help clarify for us what some of these models are so that we do understand what the possibilities are. Is that?
Yeah. The one I'm most familiar with, because I spend most of the year there, is Colorado. And it's a model that I think warrants investigation by this group because it has worked so very well there. And I don't know the exact number of PTs who are currently registered with DORA, which is their license registry organization in Colorado, but they all work in high volume practices. So when we go back to this business of it's a small number of people doing this, small number relative to the number of veterinarians in the state, but a large caseload and with zero complaints. But the model there is that the PTs have to get additional, they have to be licensed as PTs to start with in good standing. They have to have additional training in this, and they specifically spell out the anatomy, physiology, et cetera, of animals. And then they have to spend a number of hours with a veterinarian, basically in an internship type setting, until they have then been approved, at which point they become licensed by the state as animal rehabilitation therapists. The physical therapy board then has the ability, should there be complaints, to pull not only their animal rehabilitation license, but their human PT license. So they have sort of a double jeopardy thing that they're up against in that state. The PT board then consults with the veterinary board should there be a complaint to discuss, how this should be handled going forward. The PT, though, assumes responsibility for the case. So when a veterinarian gives medical clearance allowing a PT to work with that case with indirect supervision, the PT then assumes the responsibility should there be an issue. The way they are allowed to handle the cases, a veterinarian has to have a valid client-patient relationship, they have to have a working diagnosis, and they have to give veterinary medical clearance, which is different language, excuse me, from a referral. But medical clearance says, I've seen the animal within 6 months, I have a working diagnosis, and I agree that a physical therapist can work with this patient. The PT then has to have return records within a certain period of time, and it's all well spelled out, how the communication has to go between the PT and the veterinarian, and how the PT has to return the patient to the referring veterinarian for anything, itchy ears. It has to go back, obviously, to the veterinary office.
So in Colorado, a physical therapist that's working on animals will actually have 2 licenses. One is a physical therapy license, and a separate one is an animal physical therapy license.
Yes.
And they're both administered by the PT board?
Right, so the PT board assumes responsibility over both of those licenses, and so they have to maintain both. They can't just become full-time animal rehabilitation people, so they have to continue their continuing education requirements for the human side, as well as some contact hours. So all of them end up doing some locum work on people in order to maintain their human license, even if they're working full-time in a veterinary setting.
So I think that was very useful information of what Karen provided in a survey, but I obviously did not know that you were doing that survey because task force members were asked not to contact each other, and I appreciate the fact that you didn't. But had I known a survey like that was going to be taken, I guess I would ask, in that case, if a consumer has an issue, would they file a complaint with the veterinary medical board or the PT board? And then did you do the same survey for the PT boards of those states?
Complaints are filed with DORA, which is the regulatory association. So then they determine, where does this go? And DORA then, is obligated to go to the PT board if it's a complaint about a person who's licensed as an animal rehabilitation person.
So they just file a general complaint?
If there's a complaint, it goes to DORA. DORA then says, here's
so in that situation, it would potentially go to both boards in Colorado?
Yeah. We all say, how does this work? Because we've never had a complaint yet, so we're not well versed in what you do when you get a complaint. But yes, it says in the documents that the PT board gets it, and then they should consult with the veterinary board to discuss the matter.
I have an image of those little Japanese things where you put the ball on top and it kind of bounces around. And okay, but that's Colorado's model. We don't know how they do it in other states.
I'm pretty well versed on it because we teach it, but that's
no. As far as who oversees the animal physical therapist in the states? Is it always the veterinary medical board of those states, or?
Several of the states are following the Colorado model, and so spelling it out as, the PT board. And so in Colorado, the legislative change that occurred was to the PT Practice Act, right? However, the veterinary board and the PT board collaborated and were able to get this done in a 2-year time. In other states, most of them are following some similar model to that because it's worked so well. Nebraska, there's, again, the PT board is responsible for PTs, though they have additional license groups that they've brought under this umbrella, including OTs.
Lee and then Val.
This is just continuing to elicit information, although I do want to point out that Colorado seems really good at regulating newly legalized activities like marijuana. So I know that Nevada is another area that we've looked at as a potential model for indirect supervision, and it would be helpful if anybody in the room, maybe Karen or Dr. Sims, knows anything about how they manage their model and who the supervising and regulatory body is and what the requirements are.
Val and then Kristen.
I just wanted to ask Anne Marie or Kurt to clarify for everybody what indirect supervision means, because I think it's being thrown out that it it means that someone could go out and practice on animals without a premises permit and a veterinarian licensee manager. Anybody can own a veterinary practice, but they have to have a premises permit with a veterinarian who establishes a VCPR. Correct me if I'm wrong, and I would ask them to clarify that. So I don't think indirect supervision is being understood by everybody as what the law in California really says.
We're busy researching that. I would point out that each jurisdiction could define indirect supervision as it sees fit. So go ahead, Anne-Marie.
As defined in the Veterinary Medicine Practice Act, this is Section 2034, subset F. Indirect supervision means that the supervisor is not physically present at the location where the animal health care tasks are to be performed, but has given either written or oral instructions, in quote, direct orders, for treatment of the animal patient, and 2, the animal has been examined by a veterinarian at such time as good veterinary medical practice requires, consistent with the particular delegated animal health care task, and the animal is not anesthetized as defined in Section 2032.4.
Kristen, and then Dr. Klingborg.
I'm just reviewing the Nevada regulations, and it looks like they have a provision in there. It's Section 638.770, the renewal of certificates for the physical therapists, that they do have ongoing continuing education requirements in addition to enable to hold them the certification. And I didn't see that specifically in all of them in reviewing them.
Okay. Klingborg?
I just want to clarify, as we look at models, it's important to recognize that the few states that we're talking about here, there are 8 states that allow animal physical rehab under indirect supervision outside of a veterinary premise. There are 42 states that do not. So it's fine to talk about this, but let's keep in mind what's happening across the nation.
Carrie, and then Karen? Carrie-Ann?
Yeah, to that point, actually, I would like to just remind everyone that the laws can be changed and that perhaps the 8 states are right and the 42 are not.
Karen?
And I'd like to state to that effect that this map actually is a little bit misleading in that the 42 states or however many are here. It's just that those states haven't tackled this problem yet. That's simply it. They haven't tackled this problem yet. So the only states are, there's the indirect supervision states and then the direct supervision states, and all the other 42 states that you're referring to is because they haven't reached that point yet in making regulations, because this is such a new field. So this is on this is on the forefront of everything. It's not that these states believe that necessarily that direct supervision is the key to all of this. It's because they haven't gotten there yet, and we're just in the forefront, and we're one of the forerunners of this this new specialty field. So I think that's important to see, because I think that this map is really misleading into thinking that 42 states are all direct supervision states. It's because they have not addressed this issue yet.
Dr. Van Dyke and Dr. Sims?
I would just echo what Karen has just said, that in many of the other states that are about to open their practice acts, this is a topic of discussion, and it is not that they have ever discussed it before. So the fact that they don't have indirect supervision yet isn't because somebody voted against it. It's because they have never discussed it in this particular field.
Dr. Sims and Shalab?
I come from a research institution, so I always look at what the evidence states, and I appreciate the comments from Mr. Hepler in terms of the difference between conjecture, speculation versus facts. Everyone, especially in this building, a lot of people have opinions, but unfortunately, very few people sometimes bring facts. And so the facts are, what the map shows and what the survey that Ms. Atlas has found. And so the one thing is that as scientists, all of us are health scientists. We come from that background. Clinical trials, the sample size that's performed, a power test to identify what is safe, efficacious activity, you don't need 25 of the 50 states for that to occur. That we have a pretty good sample size. Here, the legislative event here, a study bill is a technique that they use in this building in terms of, let's see what this is. We have 8 states plus, and a number of hours going on that. So that's where this, I think it's been smart for us to look at these practice models in other states. Other folks have kind of blazed a trail for us. And we all agree that this is an emerging area. And so that's why there's not 49 states with only us not lagging behind that are doing these activities. And so I recognize the value of these states sort of as the testing, the research, the clinical trial for us. And to still, by law of averages, you think that after 75 years of exposure to this type of setting, and you think the law of averages would catch up to us if it was unsafe, that there would be some kind of activities, demonstrated by, disciplinary conclusions. Accusations, they're a dime a dozen. There's a lot of frivolous and a lot of missed ones, too, that should have been, cuts both ways in that sense. So I appreciate the comments that the previous folks had said about, using this information, base it on facts, not opinions. We have a lot of opinions submitted from individuals, and you could pretty much get 50% of people saying the other thing. So if we could stay to the facts, then I'd really like to see the decisions we make here being based on that.
Okay. Sheila?
I think everybody's bringing up really good points, one of which I think we're overlooking is that this is an emerging field, let's say, and the changes in the Practice Act and the changes in the laws are very new. We really don't know how they're affecting the consumer, and we are here again, to keep repeating it, here to develop protections for the consumers. We don't know how this is affecting the consumers yet. It's all too new. So doing something just because another state is doing it, I think, is not a qualifier. I think if another state is doing it and it's working there, then it should be considered, but we don't know yet because it's all too new. So I think we need to approach this with caution. I'm not saying that direct supervision is right or wrong. I think in some cases it is. I think in other cases it's completely inappropriate. Again, for wildlife care and for barn animals. So I think we need to look at the very, very big picture, and I think we need to look at the long game here.
It's very tough being the greatest state in the nation and the most progressive. And I would dare say that no other state had such an august body thinking about the issue that we have here. At that point, I'm going to press another pause button because I think we have 2 more task force members in the room. Come on down. You're too late to get one of these big chairs, but we do have some additional chairs in front. And I would ask you to introduce yourself and who you represent, please. And we got to take a break. I don't know if I want to leave this now, but I don't know if it's going to end soon.
I know. They introduce themselves for the sake of the audience knowing what we've been looking at. I'm going to make a quick speech.
I hate traffic. My name is Sandy Gregory, and I'm representing the RVTs for the California RVT Association.
My name is Carrie Schlachter, and I'm representing the Northern California Association of Equine Practitioners.
Oh, pardon me, you two don't like each other? No more space, I think we could have there.
Wow. Anne-Marie?
Yeah, just for the sake of the public and those that may be viewing the documents that we have been discussing off and on, we're talking about a animal physical rehab map. It's item 3 on the links. And again, we're just talking about factual information, and I know that that's been challenged, but it is in fact where the states are at this point. Nevada regs are item 7 under the link. Item 6, Colorado regulations, item 7, and Nebraska's regulations are item 8. For clarity, both Nevada and Nebraska have animal physical therapists under the Veterinary Medical Board's Practice Act. It may also be under the Physical Therapy Board's Practice Act in some form, but that's not the information we have before us.
Was there a question or a comment over here? Dr. Klingberg?
A couple different things here on the subject of states. You know, as we look at the profession and we in fact go back in time to when this profession started and we were a group of blacksmiths and farriers that became veterinarians, as we did that and created a standard, the veterinary profession, there were blacksmiths and farriers who got excluded because they did not have the skill set in order to be veterinarians. We elevated and created a profession. And in that, I can imagine in 1885, the argument around a table like this was that the consumer was getting fewer choices. But what the consumer was also getting at the same time was better service, more quality. And so there is that conversation. The other part of this conversation is that as we have added new skill sets to the profession, this is the first time, as I've in my career seen animal dentistry, I've seen ultrasonography, cardiology has grown, and we have collaborated with the human medical counterparts on it. But this is the first time that I've seen the human medical counterparts say, we want a piece of that too. We need to be part of that too, not just a collaboration, but we want to carve out our own piece of that pie. These states that we're talking about, the 8 that we're talking about that have addressed it, they may be the forward thinkers. And I'm certainly open-minded enough to that. And I don't know that there's been many people sitting at this table that have spent more time thinking about this issue over the years than I have as well. But the states, that the other 42, may not have addressed it directly. But if I went to Texas right now as a physical therapist and tried to do animal physical rehab, it would be against the law. It would be the practice of veterinary medicine, and it would be against the law. Maybe they haven't specifically said that, but that's the understanding. That's the way that that's written. So it's simply, I get it. I understand. I want to continue to have that conversation. I'm hopeful that everybody's fairly familiar with these state models because they've been in your packet for some time, and we can start to try and develop what our own model is going to look like.
You know, an interesting point that you may not know is not every state veterinary medical board has the authority to go after unlicensed activity. So thank God that we have the authority to go after unlicensed activity, because that would make it even more complicated, what we have to do. Carrie Ann?
I would just like to say that in the last 50 years or so, healthcare has changed so much. I mean, we look at human healthcare, or I'm going to talk about human healthcare, but the model has changed so much to include Chinese traditional medicine, to include Ayurveda, to include homeopathy, and all of these other modalities that are not Western science. And I don't know, I hope there aren't very many more human medical doctors that are completely unaware, completely ignorant, or completely opposed to the evolving nature of healthcare. I don't think it's possible, especially in my experience. I've had a lot of experience with alternative or holistic healthcare for my animals, that I don't think it's possible to not begin to bring those into a changing model of healthcare that respects all of the players, that possibly Western science, maybe it's not a pyramid, but it's something else, whatever that is. And in terms of California being at the leading edge, or some of these other states already going towards that leading edge, that the Practice Act may have to evolve to reflect a general change in our society. in terms of what is legitimate health care and what are the legitimate theories of health care. Thank you.
Joe?
Hi, I'd like to bring 2 points. One is that we're talking about 8 states, and 5 states actually require direct supervision. And the actual states that maybe haven't discussed or maybe have discussed but leave it as it is was 35 states. The other thing I like to mention is that we understand the medication, the medical field has been involved over the years, and we as veterinarians, at least from what I hear, we actually don't exclude, and we have no intention to exclude our allied professions to help promote animal health. But we're talking about how much supervision that is required and what's the best for animals here we're talking about. And I have some very great colleagues, they're doing amazing stuff in dogs, and they wouldn't jump up and say, I think I can do something on human. And which means that the training on the basic is very different. So the level of supervision should be discreted as well. Yeah.
Dr. Sims?
Dr. Sims here. I have a comment just from some of the comments that Dr. Klingborg just made in terms of characterizing maybe some of the motivations that he is hearing here, thinking he's hearing from the physical therapists involved in this activity, and that the term carve-out is pretty egregious and unfair. You've heard Dr. Van Dyke say that the veterinarian is going to be intimately involved in the care, and it's with that relationship there. I think that an orthopedic surgeon that does a carpal tunnel release on a primate down at the San Diego Zoo is going to work in collaborative and is kind of a collaborative work with the veterinarian, and so will the physical therapist in terms of being that team player with them. And so to say that all these other professions have kind of started playing ball with us and doing things, but now there's a group wants to carve out stuff is very unfair and inaccurate.
Mr. President, I'd just like to remind the members that what item of agenda we're on. I sound like a little bit of a broken record. This is animal rehab models from other states. We've had testimony in the past about what motivations may be ascribed to by various members. I would prefer that this august body not go there and remember its primary obligation of consumer protection. And so, like I said, I apologize for sounding like a broken record, but the object of this committee, I don't think, is to attack or denigrate or to knock down when somebody offers some facts or whatever. I would just hope that we all understand the reason we're here. It's not personal. We're here for the consumer. We're here to answer the obligation that the legislature gave us. So with that, I'll be quiet.
Any additional comments from the task force? Any comments from members of the public? Okay. So I think that now is a great time to go to lunch. We will break for an hour, and we will reconvene at 1 o'clock. I hope that everyone enjoyed their lunch, and remember that the reason why we're all not going to get violently ill is because at some point there was a regulatory body that set up all the rules that made sure that didn't happen, and that's why we're here today, to make sure bad things don't happen. The next agenda item is going to be discussion of educational and training requirements for veterinarians, registered veterinary technicians, and so forth. The educational and the Veterinary Medical Board has the authority to adopt regulation establishing healthcare tasks and an appropriate degree of supervision required for those tasks that may only be performed by a registered veterinary technician. The Veterinary Medical Board also has the authority to adopt similar regulations establishing tasks that veterinary assistants can perform and what level of supervision is required by a veterinarian or an RVT. So this is what we're here to do, essentially, in this section. What I propose that we do first that might help this process along is first come to an agreement that there are 5 categories of people that we are talking about, and that would be veterinarians, registered veterinary technicians, RVTs, veterinary assistants, physical therapists, and physical therapy assistants. If we first come to an agreement that those are the 5 categories of people that we're talking about, I would then propose that we take each individual category and then talk about, number 1, what education and training is required. Number 2, what level of supervision is required. And number 3, address practice locations, practice settings, and so forth. Because, as we know, this is where the real nitty-gritty comes to head. And I think that if we approached it that way, it might be helpful in getting through it. Comments? Dr. Van Dyke.
A and B are under additional certifications and specialties. Did you want to get into that at this point or hit that as after we've done the basic discussion?
Well, I think that would be, if we can agree on there's 5 classifications that people are talking about, then on those other 3, the first one was what education and training is required. That is where certification and specialties could fit in when we're talking about those requirements. It's a thought that I put out here, and I think it might be helpful, but it's not set in stone. If somebody thinks we can do it that way, or if somebody disagrees, then we can.
I guess I would just like to clarify the difference between an educational requirement and these additional certifications and specialties, so that.
What I had anticipated is if we are, for example, talking about first the veterinarians, the question is, do they have enough education, or do they need more? And then that's when we can have a discussion of what more would they need, and then that would fall under certifications and specialties.
Mark, my question here is on whether or not we need to identify or define laypersons, and I'm wondering if a layperson, if they're functioning within an animal hospital setting, simply becomes a veterinary assistant, then that's fine. I think we're good. But I don't know about that category, if we need to be discussing them or defining that in any different way.
So the definition of 4 of those categories is clear. The definition of a veterinary assistant is not clear.
Well, it is and it isn't. Unregistered assistants in an animal hospital or veterinary assistants in an animal hospital setting may perform auxiliary animal health care tasks under the direct or indirect supervision of a licensed veterinarian or the direct supervision of an RVT. So that's 2036.5. I think.
Would it be helpful if we had those 5 categories, but made a clear definition that a veterinary assistant is a person within a veterinary practice?
I just, at least for this discussion, I think that we need to be clear on that, yes. By consensus, if we're comfortable with that notion.
Chair Nunez, I would agree with that. I think what would be helpful is to clarify that what's already identified under the Practice Act are veterinarians, RVTs, and veterinary assistants, and that the other 2 areas of practice that you're describing exist, but are not currently described in the Practice Act.
They're not described in our practice.
Correct.
And I think there is a clear definition of what they are.
Yes.
Dr. Sim.
Mr. Chair, I think to help us make sure we stay on the agenda, and I don't want to take Kirk's job here, but We're just looking at the discussion, the education training requirements, or whether that then, what practice setting they're allowed to do what, and yet I hope that's going to be down in 9, probably a D or E. And so right now, just to keep things, organized, if we talk about the education of the group you identified, and then what they can do later, that's, I think, that number 9 discussion. If we do that, it gives us kind of some foundation from which then to have the next discussion and not to almost have it too many. So if we probably stay true to the agenda, it would be better.
Yeah, I did realize that I may fall into an agenda issue pothole because I think supervision and practice setting are paramount in the discussion we're about to have. And I asked Kurt's permission to sort of do a, what word did we use? Compress or congealing or consolidate.
I go with amalgamation.
Amalgamation. Supervision and practice setting definitely have to be talked about. And even though they are in agenda item number 9, I think that we should be including that. So if that means moving 9A or 9D and E up into agenda item 8, which is now education and training, would that be allowable?
I'd like, what are synonyms for 200, Alex? I think, with the body's indulgence, I think we can compress or commingle sort of the new 8, which was the previous 7, and as it reflects on those other things, supervision and practice settings, I think if the body wants to sort of discuss all those at the same time because they're interrelated, then I think that's within their want.
You are most gracious. So then I would propose that we come to an agreement that, first of all, we're talking about 5 different categories of people: DVMs, RVTs, veterinary assistants, physical therapists, physical therapy assistants. But we also make the further clarification that a veterinary assistant is a person practicing within a veterinary premise.
As it already states in 2036.5.
And then, again, further clarification of veterinary premises is that a location that holds a premise permit, which is administered by the Veterinary Medical Board. Shala.
You're referring to an unlicensed assistant?
The politically correct term is veterinary assistant, but they've also been referred to as an unregistered assistant.
I'm just going by what we have here on the...
Yeah, there's various names for that category, but it's officially referred to as a veterinary assistant. But it also has been referred to as an unregistered veterinary assistant.
Can we just use one term for the sake of clarity here today?
I've been using one term, and that was veterinary assistant, but yes, I would recommend that we all use that same term.
The challenge here, Shala, is the language changed. So it recently changed from unregistered assistant, which is still in print, but the new approved term by the Vet Med Board is veterinary assistant. So we've got old
language. And then we have unlicensed assistants written here.
Where are you seeing that?
Under item 6, unlicensed assistant.
Well,
should say unregistered.
Yeah, it does say that on the agenda. I guess the idea that I am proposing is not written down. I'm just proposing this. And I use the term veterinary assistant, but that, like we just said, has also been referred to as an unregistered assistant.
Or unlicensed.
Unlicensed.
They're all interchangeable. Okay, thank you.
Yeah.
For the sake of the viewing public, the language has been changed in the Practice Act. We've got legislative consultants here. It is technically a veterinary assistant, and that is how it's reflected in the law. So I would suggest that the committee reflect that the change has already been made in the law and that we use that terminology here. Thank you.
Christy is not in the audience, but she would be proud of me. Okay, so I don't know if I can make that motion, but I propose that we do that. If someone would like to make that motion.
So moved that we have identified 5 different groups of individuals that we'll be discussing as we move through the agenda items for the purposes of enumerating education and training requirements, as well as supervision and practice setting requirements.
Seconded.
It's been motioned and seconded. Are there further questions or comments from the task force members? Are there any further questions or comments from members of the public? Hearing none, I would call for a vote, please.
Dr. Nunez.
Yes.
Lee Heller.
Aye.
Dr. Klingborg.
Aye.
Karen Atlas.
Aye.
Sandy Gregory.
Aye.
Kristen Hagler. Dr. Holland.
Yes.
Dr. Schlochter. Dr. Sims.
Yes.
Oh, thank you. Sorry. Dr. Troy. Yes. Dr. Van Dyke.
Yes.
Dr. Waldman. Yes. Dr. Chow.
Yes.
Shala Bar.
Yes.
Bill Gage. Yes. Carrie Ann Colley. Yes. Valerie Fenstermaker.
Yes.
Leandra Clark Harvey. Thank you.
Okay, then, having done that, my next proposal would be to start to break down each individual category in 3 areas, and that would be what education and training is required. Number 2, what level of supervision is required, and number 3, what would be the practice setting that's required.
Do you need a motion on that?
No.
If we can just go ahead? Okay. So let's start with veterinarians, and let's start with education and training. And what I think would be helpful would be to understand exactly what already is in place. On a regulatory standpoint, the education and training requirements have been established for veterinarians to perform this task, but I think we need to know what that training is. And so the university representatives, I think, would be most helpful in chiming in at this point. That's your cue.
So at UC Davis, education is a 4-year postgraduate or post-undergraduate training. And what we're doing implementing the new curriculum is actually now it's all generalized by, so on the curriculum you actually won't see a specific topic of veterinary surgery or veterinary physical therapy or physical rehabilitation, sorry for the wrong term. But instead, we do it in the clinical foundation and in the 3rd year and 2nd year. So that goes into animal physiology of all the different species. And we break it down into different systemic disease. We use a case-based learning and discussion-based learning, disease-based learning and case-based learning. And in the hope to provide the training that is more applicable into clinical situations. And I always say that you're going to be kind of a contractor to choose which toolbox you're going to use. So we provide them the basic knowledge of physiology and pathophysiology so that they know which toolbox they're going to take. The idea is that we're not going to be able to teach, because the way how medicine has grown, we're not going to be able to teach the future veterinarians all the skills and techniques in the toolbox they will be using in the future for treating animal disease, but instead we emphasize a lot on how to differentiate the disease process and how to understand the disease process and provide the correct recommendation. Current regulation in California Veterinary Medical Board, it will be to pass the NAFLE and also to pass the California license exam to be eligible for veterinarians. I don't know if there's any any other. But just a brief way is that what I really want to emphasize is that if you find for a specific topic, it's probably not going to be shown on the curriculum itself. But if you look into the handouts that we give the students, then you will know that we actually cover them all.
And also, I'd like to point out that the UC Davis curriculum for rehabilitation is item number 11 on the hyperlink page. That's correct?
Yeah.
Okay. There's also a lot of certification programs in this list in no order whatsoever, but specifically what is the curriculum for DVMs going through UC Davis is on number 11.
Yeah, so during the first and second year, we do have integrated medicine club, which we give lectures to about 2 to 5 annually lectures, and they also have monthly 3-month hands-on and laboratory sessions, which we're talking about more on rehabilitation part. And on third year, they have lectures on the general rehabilitation for orthopedic surgeries, and they have case-based learning discussions. They also have lectures on palliative care for oncology patients, and on the large animal stream for equine emphasized students, they have lectures and lab for integrative sport medicine. In clinical education, you can read through it, but we do have an integrative medicine rotation, which they go see new outpatients and inpatient consultation for all the different types of patients on the equine part as well. But what I really want to let the public know that the idea of us is teaching them to choose the right tool. So even if you just look, it doesn't mean anything if you just look at the numbers of hours that we put into the education, because for us it's a set of the toolbox. Yeah.
Is there, can you speculate on the number of hours that is spent on that particular subject?
You mean for rehabilitation? It's here.
And then are these classroom settings? Are these clinical settings?
Yeah, so clinical rotations were 2-week minimum rotation, and they're here like 12 hours a day, Monday to Friday. So that's for the 4th-year rotations. For the third year lectures, we have a total of at least I think 10 hours of lectures on it, and case-based discussions as well, which is actually they spend the whole 2-week period looking into cases and find the answer. So I can't really say how much time the students put into it, but usually it's an outside classroom discussion among the students. Yeah.
Caseload?
Caseload at integrated medicine.
How many cases are seen?
On the 4th-year rotation? Just a rough number. So we see patients we see 2 patients every hour for 5 days a week. And we also have, new patients, and we also have ongoing patient coming in probably every half an hour. And right now, our integrated medicine service is booked till December. So I can't give you a number of how many patients we're seeing every day, but we're seeing at least 10 to 20 patients a day.
And what about outcome assessments? How do you know that the students are learning these topics?
We do have, I can't answer that question top of my head, but we do have student evaluations, and we are always improving on the outcome, I would say. But most students who are in the rotation are interested into going into advanced training as well, which I think we'll discuss later. Yeah.
Okay. Dr. Van Dyke?
It's a little unclear from reading this. In the first 2 years, it's a club, how many of the students in your total student body take part in that club?
I would say about 1/4 to 1/5 to 1/4 of the students that take the club.
All right, so that's in the first 2 years. And then in the third year, you said you have about 10 hours, but it appears that in the stuff that's listed here, rehabilitation is put into a kind of a pool with acupuncture, chiro, et cetera, et cetera. Is that correct? I mean,
It is a general introductory session. It is correct.
Okay. And then in the fourth year, do all of the students rotate through these small animal integrative medicine rotations?
I think it's an elective rotation.
Right, because you got 1 to 3 students each rotation, so that would say you've got a pretty limited number of students that can do that.
With every rotation field, I think about 60 to 70% of students actually take the rotation.
Take that rotation?
Yeah, because every rotation is filled.
Right, okay. And again, then this is your integrative medicine service, so they're doing neurology, orthopedic surgery, soft tissue surgery, oncology, internal medicine. It's listed here.
Yes.
All right, thank you.
Dr. Klingborg?
Dr. Chow, last time when you were talking about the curriculum, you mentioned how animal physical rehab does integrate and that the students would be involved in a surgery.
Yes.
And then they would be involved in the aftercare that might include APR. Can you kind of describe that process?
APR?
Animal physical rehab. That's the cool new acronym for it. Yeah, everybody's talking about it.
I thought it's something about mortgage.
Yeah.
Yeah, so like I say, in every aspect, almost every lecture on the treatment choices, we talk about physical rehabilitations, and then we mention the modality that potentially could be used. What listed here is our rehabilitation specialist, the didactic teaching given by her. But I would have to say, in my lectures, I talk about it. In some other oncology, internal medicine, they talk about it. Other surgeons' lectures, they talk about it as well. So not all patients goes into that integrated medicine. Not all of our patients go into that integrated medicine service, and not all students. How do I phrase it? Students that are not on integrated medicine service are also exposed to the integrated medicine part, but just on a different depth.
Shala?
I think Karen raised her hand first. I'm probably going to say the same thing.
Karen?
One of you, please.
Dr. Chow, from your speaking from last meeting, you noted that the students learn how to diagnose and refer, but not necessarily how to execute each modality. So are there specific, are these the use of the modalities? Is that correct then, that they're not really taught all the modalities and the parameters and the safe use of these pieces of equipment that could potentially cause harm?
They have a lecture on it.
A lecture?
Yeah, they have a lecture on it. And when they go through the integrated medicine, they do learn that.
Okay. And are there hands-on, so do they get tested on it? And so is there hands-on instruction on how to
If they go through the rotation, yes, they do get evaluated for that. We don't use the word test anymore because they get evaluated. Yeah. Yeah, and in general, the evaluated results are pretty good. That's all I can say. Yeah.
I think Karen and I are on the same track here. If I understand correctly, not every student that goes through UC Davis gets an education in APR. And the APR that they're exposed to is not a full-on, it's not the same as if they were specializing in physical therapy or orthopedics or rehabilitation. It's more an exposure to.
Sorry, could you phrase that? Could you say that again?
I'm just trying to interpret what you're saying. So not all the students are taking these lectures and going on these rotations.
Oh, sorry. All the students have the lectures, but not all the students have the rotation.
So they have limited access or limited exposure to APR modalities.
I don't know if that's the right way to phrase it. I believe they have appropriate training and appropriate knowledge to choose which animal and which patient require APR trainings, and they know what those involved. But not all students are exposed to the detail, down to the detail like you're asking, unless they take the integrated medicine rotation.
So if they take that rotation, even then, are they trained to diagnose and treat?
It doesn't matter if they take the rotation or not. They're trained to diagnose and refer, and they're trained to know which one to refer, which one not to.
Are they trained in, let's say, the finer points of APR?
Okay, this is a very broad question. I don't know what's the finer point you're talking about.
I think she can clarify what I'm trying to ask.
Would you refer a case to them?
No, I wouldn't. But they would know who to refer to. They would know when to refer.
Right, exactly.
Yeah.
Thank you.
Carrie Yan and Dr. Wolman.
Thank you. My concern taking an animal to a veterinarian to have a diagnosis and a referral, even in-house, I would be concerned the depth of knowledge that the veterinarian had acquired to either be able to train and or supervise the people they have in-house. If the initial training is to diagnose and refer, that is it's a triage function. It's perhaps a beginner level when they graduate. I am inexperienced. I know you're shaking your head, but in experience, it's not the same as a veterinarian who's been in practice for 10 or 20 years. That's just.
Well, the reason I brought this up is that there's no way we can teach every student or every veterinarian all the knowledge they know or they should know in the 4-year training.
Yes, but what I'm saying is that in whatever law or regulation that comes about, I would be concerned that a veterinarian who is diagnosing and referring to, whether it's in-house or indirect, whatever that is, direct or indirect, that they have the depth of training to, if they need to supervise someone in-house, not the academic level or basic clinical level. Is that still unclear? I'm sorry. They have to be,
Yeah.
The old model of regulation specifies supervision and possible training.
Right. Let me try to jump in here to address the way that this conversation is going. In your package, you've also, there is, I don't know what number it is, it's near the bottom. It's the North American Study of Entry-Level Veterinary Practitioner.
47.
And the extreme knowledge and information that is out there in the field of veterinary medicine is ginormous. It's enormous. It would be impossible for students in any field, not just veterinary medicine, but in human medicine, to be trained completely with all the educational and clinical opportunities that are out there. Mm-hmm. We all know that there is a need for there to be a veterinarians in our culture, in our lives, and veterinary schools provide on an annual basis a whole new shipload of veterinarians that need to be trained adequately as an entry-level veterinarian. And I had an opportunity to participate in a focus group for the National Board of Veterinary Medical Examiners. And it was extremely impressive in what they do. On first impression, you say they make the test that veterinarians need to pass to get their license. But then when you look more into it, there's a real sophistication in what is required in our civilization for veterinarians to be present and how to best ensure an entry-level veterinarian. And so the way they do that is they first put out a survey to everything that's going on out there. And so they want to know what's happening currently in veterinary medicine and what's happening in cardiology, what's happening in dermatology, what's happening in physical therapy. Then they ask the question, in order for a veterinarian to delve into these fields, what would be expected for a person to know to be able to do this without supervision? And that's really the definition that a veterinarian has, that they can offer a service or perform a task without supervision. And they ask the specialist in these fields, what would you want a veterinarian to know in your field so that they can practice without supervision? The responses are then taken and formed into a question that can be put onto an examination. That's a very simplistic way of putting it because it's actually very complicated to make a question that's placed on a national examination because you have to take a lot of things into consideration. I think there's a term for a person that professionally makes tests. A psychometrician. So after hearing them talk, I am very much impressed that they do know how to make a test. And that is what is placed on the national boards. But also, that is what is taken by the various veterinary schools when they're developing their curriculum. Because the schools also have to evolve with what they need to teach veterinarians. And as new fields arise, then there's going to be more and more teaching on these fields, and there's going to be more and more questions on the test. And your package does include some information on that survey with how much physical therapy is done out there, and also specifically how much questions are on the examination. So to start to go in the direction of you have to know absolutely everything about physical therapy in education and training before you're given a license to practice it, understand that potentially you're also asking that for the rest of the fields, and to expect a veterinary student to know all that in 4 years is not a possibility. Not to mention the fact that Hillary is promising free education. I don't know how that's going to work. Oh, just undergrad? So that's something that you have to keep in mind when and remember, we're just talking about the veterinarian here. So keep that in mind when we're talking about are they sufficiently trained to practice physical therapy? And remember that a lot of veterinary students know what type of veterinarian they want to be. They know that they want to be a general practitioner, or they know that they want to go into physical therapy. And those will probably be the students that are going to join the club in the first 2 years and take the electives. So those are the ones that are going to practice physical therapy. Are all the students that graduate going to do it? No. Some of them are going to join the cardiology club or the dermatology club or the surgical club and so forth. So keep that in mind when we're talking about the educational requirements that we would like veterinarians to have. And is it sufficient? Dr. Waldman?
I think you already said a little bit of what I was going to just comment on, which is that everyone who's a veterinarian knows this, but anyone that's not may not know that in veterinary school, I don't know if all of them do, but the one I went to, which was not in the state, and UC Davis tracks, which means that you're choosing small or large animals, and then you're focusing your curriculum as well as your clinical rotations based on what you choose. So when I chose small animals, when I took my national board exam, I was still tested on large animals and chickens and things that I can't remember, but I had to know a minimum amount. Okay, so I guess the point is that you're tracking with your interests. Vet school provides an actual route for that. So if you're tracking for, animal physical rehab, acupuncture, the schools are giving you these opportunities to begin your education. Additionally, I wanted to tell you that I have veterinary students from UC Davis come to do rotations with me during their veterinary school, 2 weeks. So that's another educational component that's not listed there. And I've talked to the Western professors about doing that as well.
Yeah, I mean, with any system the way it currently is, it's very easy to find fault in it. But try to think about what's reasonable. Val.
So I think part of the curriculum that hasn't been mentioned, and as long as I've been around the veterinary profession, and every veterinarian could speak to this better than I can, but animals don't talk, and every veterinarian is taught how to diagnose, assess. Their experience plays into the fact that this isn't just about physical therapy. This is about the whole animal, the whole patient, what's going on with it. And I don't want to take any of your places, and I would love if you'd speak to that, because that is the critical thing here that we're not talking about in a veterinary education. Very different from human medicine. And I would invite one of you to comment on that, if I can.
Thanks, Val. I think it's a good point, because oftentimes our patients come in with what the owner thinks is one presenting sign, and it may be completely different. It may be what they've observed or smelled or noticed a change, but we may find complicating issues going on, which oftentimes we do, or we may find that the client is misdirected or misguided, and our job is to get them back onto track. I passed out a list earlier, I don't know if this is the appropriate time to bring it up, of all the comorbidities that I have seen in my rehab patients. I have a little different model than Dr. Waldman does. I have a general practice and a rehabilitative pain management practice integrated in one. And in that list, it's a very short list of what the patients walk in the door with, but many of them have complicating diseases. And we've had crises. We've had animals that have had to be euthanized when they've walked in the door for rehab because they've gone into crisis. And if it had not been into a veterinary hospital, that animal and that client would have suffered immensely. So when it comes to balancing, the other list that I provided for the group was a list of medications. Some clients come in and they don't know what their pet's diagnosis is. They've given us a report from their general practitioner, but forgot to mention they see the cardiologist, the dermatologist, and the surgeon as well. So they bring their medications with them as we request, and they're on medications that they didn't list. So we have to sort all that out because the patient can't tell us. And these are the factors that are very real in veterinary medicine, not just in rehab. When I get a dog in with a bad ear that, oh, by the way, has a pendulous abdomen and has got a belly full of blood, or I get a dog in that's limping that has the worst cardiac murmur or is in congestive heart failure, or a dog that presented several weeks ago for a mild lameness when the referent saw the vet and was non-weight-bearing lame and had a bone tumor. It came in for an ACL tear. So these are not simple cases, folks. They really are not. And if they cannot be sorted out at the time they're receiving services, these animals are going to suffer, and so are these clients. And a lack of a complete diagnosis is a frustrating thing because our patients change. I have lots of clients that have had their patients seen by their referring veterinarians 5, 6, 7 weeks before. It takes a little while to get in, and their status have changed dramatically when they walk in our door. That's not the referring veterinarian's fault. That's no one's fault. But if there is not a veterinarian there to assess that animal in its entirety, does it have bulging eyes? My 2 RVTs have diagnosed ocular tumors in 2 dogs. They'd been seen by veterinarians weeks before, and they weren't there then. So these animals change very, very rapidly, and we do assess all their body systems. We don't see them for just one thing when they come in.
Dr. Klingborg and Dr. Van Dyke.
Kind of got two different veterinarians we're talking about here, I think. We're talking about the veterinarian that's the new graduate or the one that's going through the curriculum, and we'll hear from Western and about their curriculum in a little bit. But one thing that the veterinarian that's the new graduate or in school and the one who's graduated have is a commitment to lifelong learning. I mean, part of going through the process is learning how to learn and learning how to gain new skills, knowledge, and aptitudes. And I think it's a little unfair to say, gosh, these new veterinarians are not graduating with everything they need to know about animal physical rehab in the same way that probably most new veterinarians have not done any thoracic surgery, which I would propose probably poses greater harm to patients potentially than animal physical rehab does. But what they've learned in the curriculum is when they need to refer, which has been discussed, and they've learned the principles of surgery, the foundation that they need to be able to do to work through that kind of a process. And so when am I in over my head, or when can I handle this? The other veterinarian that we're dealing with, the graduated veterinarian, has gone through that 4-year program, and if they have a 25-year career and you add up all their CE hours, they will have just as many hours postgraduate as they do in their curriculum. And again, it's whether it was mandatory or not, veterinarians were doing it. It's mandatory now. So, and we have ample opportunities. We talked about at the last meeting, all of the books that are out, webinars. Every major CE meeting now has something about animal physical rehab taking place at it. This discussion is mainstream, folks. And so not only is it in the curriculum at the #1 school in the nation, but it's also available to all the veterinarians that are out there in practice after the fact.
Dr. Van Dyke?
To your point, Dr. Klingberg, we're talking about two different groups. One is a group of relatively new grads who have some exposure to rehabilitation. The other is the vast majority of the licensed veterinarians in this state and all the other states who had no didactic training in it and who are picking it up through webinars and an occasional lecture at AVMA or something along those lines, and have really, therefore, very limited tools with which to offer rehabilitation in their practices. So I think at this point, the question I have is, are we discussing the educational level of veterinarians and their ability to offer rehabilitation as they stand today versus, are we going to discuss any kind of requirement for them to pursue additional training? Or are we looking at the difference between a physical therapist who comes in with 4 years of physical therapy training and then spends time working with veterinarians? I can see where a PT would sit here and say, okay, guys, you think that in a couple of webinars and maybe attending a 2-day thing at AVMA, you've become a physical therapist. No more than a PT thinks that by attending a course like we offer, that they're becoming a veterinarian. Yes, cases come in and they change. And yes, your technician can pick up an ocular tumor. I would, first of all, say I don't think they diagnose that because it's beyond their scope of practice any more than a PT would diagnose the same thing. They would evaluate, see the abnormality, and the sort of histrionics that I'm seeing about all of these disaster cases coming in and the horrible pain and suffering that the clients would experience. For some reason, it seems to only be happening here because we're not getting those reports elsewhere of people going through this horrific loss of patients to rehabilitation centers where there aren't veterinarians on board. So I'm a little concerned about the level of discussion floating toward imminent danger and disaster for all of these patients that are seen by physical therapists in their practices or by, frankly, it could be by veterinarians in their practices, assuming that they know how to do rehabilitation.
Yeah, and I guess remind that we're talking about veterinarians. So let's keep the discussion to veterinarians, everyone. Dr. Klingberg and then Carrie Ann.
So two things, even the 8 most permissive states that we've talked about with the map still allow veterinarians that have graduated to do animal physical rehab without any additional certification. So the number right now is 50 out of 50 states. The other thing is that when I was at University of Tennessee, they have the same histrionics as well. And they also spoke quite candidly and graphically about some of the cases they had seen that hadn't gone well because there had been inadequate supervision. So it does happen, and it's not just happening here.
Carrie Ann, and then Shala.
Yeah, I believe, from my viewpoint, I would like to see education and training specified for every level of vet, whether that is the result of veterinary school education or whether this is a long practicing vet and they need to go back and get a certain level of training to be able to provide, supervise, or train others. That's what I would like to see if I were a consumer. Reflecting on the realities that you're talking about, a new vet or somebody who, as Dr. Van Dyke was saying, may have had just limited exposure with continuing education hours. That's what I would like to see.
And I would remind task force members to keep in mind that if the recommendation from the rehabilitation task force to the veterinary medical board is we feel that veterinarians should have additional training in all fields before they do anything, that recommendation is probably not going to go very far. And the very good points that we're making are nothing's going to be done with them. So just keep in mind practicality in the recommendation. Keep in mind the recommendation that we're going to be making to the board.
But you're saying such a recommendation would imply that all specialties need that. And you said it wouldn't go very far, but very far with whom?
Well, I think you said that everyone, if they want to practice in physical therapy or cardiology or dermatology, choose your field, then get more training. If that's the recommendation that's going to come from this task force, it's a tough sell.
Well, the veterinary field has to change just like medicine has had to change. Human medicine, pardon me. It's painful. Human doctors don't like it either.
It's challenging. All these concerns are very real. And so be practical on how we're going to try to fix it. The way it currently is, I believe, I think that the average veterinarian fears the veterinary medical board. I am the president of the veterinary medical board, and I fear the veterinary medical board. When I practice medicine, everything that I do every single day, I have to pay close attention to. I have to know that I'm doing it properly, because if I make a mistake, first and foremost, I would be horrified of what I've done to this patient that was put in my care. And number two, I know that I would lose my license. And so there are things that I know I shouldn't do, that I don't have the proper training to do, that I don't do. That's how, in reality, that's how we are currently addressing all of these issues that you're bringing up. The point has been raised. We have to do something, because if we don't, harm is going to happen. And we're making proposals that you need additional training and certification and so forth, which is reasonable, but challenging. The way it currently is as I presented. So the question is that good enough? Is there something that's broken that we have to fix? And I only mention that not to discount any of the issues that have been raised, but I bring that up as a point of practicality. That's all I have to say. Shala?
I think I want to make a couple of points. One is, in general, I think across the board, just because somebody can do something doesn't mean that they should. Just because an education or the law says that you can perform a certain activity doesn't mean that you are qualified to do it or you should do it. Not everybody has the ethics or the morals that you do or we all do here. I think what we're saying here is that physical therapists don't have the education to perform APR on animals, but we're saying that veterinarians who don't have an education in physical therapy can perform that on animals, and there is a hypocrisy there. And I think just because something's challenging and difficult doesn't mean that we shouldn't address it or we shouldn't challenge it. We are not here to shy away from what's difficult. We're here to create consumer protection. And I know I keep saying that, but I mean it. That's what we're here for. So if the consumer is not served well by someone graduating from school and thinking that they can perform APR because they're allowed to, I think we need to stand up to that, and I think we need to readdress the entire system. Another point I want to make, Dr. Klingborg, I did read your letter about your visit to UT, and absolutely no disrespect to you, but the conversation that you said that you had was entirely hearsay. There's no documentation of that at all, and if you have any, I would love to see that. My experience with Dr. Millis and Dr. Levine have been completely different.
Well, I did not speak with either Dr. Mills or Dr. Levine.
Right.
So I did mention the doctors with whom I spoke, but those two individuals that you referenced did actually respond to
I saw the letters.
And I think that their letters speak for themselves.
Kristen, Lee, and Dr. Van Dyke.
I was just going to go back to the veterinarian furthering their education. Are we talking about additional hours above and beyond what's already required for their licensing? Or are we talking about specific course-geared things for whatever specialty the person's working in within the framework that we already have? You know, is there something that, because if we add on more education, CE for people, that's going to increase everybody's costs and it'll trickle down to the consumer potentially. So is there maybe a regulation or a recommendation that we could put forth that if you're going to work in a specialty, a percentage of your continuing education that you're already having to do should be focused in an area instead of adding more to it? Because these people that are going to be doing things in a specialty, we're going to gravitate towards what we're most interested in anyways.
Lee, Dr. Van Dyke, and
Chair Nunez, we're in a pretty sticky issue right here, right? Because what everybody wants is for veterinarians to be competent at what they're doing. And as Dr. Klingborg has repeatedly said, and Dr. Nunez as well, the amount of material a veterinarian has to cover to graduate and then pass the tests and practice is huge. It's not one species, right? At least human doctors have that. So what do we do about the notion that we feel that to practice specialties, people should have additional training? This has been an educational experience for me. So when I was an activist on this issue before I joined the board, I'm like, yeah, you know, veterinarians, they shouldn't do animal rehab unless they have additional training. And then, as I said earlier today, I read the Practice Act and also started thinking, well, if we're going to require that for animal rehab, it's more pressing for orthopedic surgeons, for cardiologists, for neurologists. So how do we address the fact that we're asking for additional expertise in this field, but not in those where there's probably more risk to animals? Or if we go where Kristen is going, that's beyond the purview of this task force. So it's not the wrong question to ask, but it's a question we probably can't answer today. So from my own perspective, much as I would like to see every veterinarian in practice who's doing something specialized have additional training, because I've seen what can happen when they don't. I'm a high volume consumer of veterinary services. I've said that in front of this board before. I'm, you know, God, I know every vet in Santa Barbara, and I'm in my vet's office so often that's kind of a joke. I really don't want to see a generalist doing things that the generalist is not competent to do. But I don't know how today we can say, all right, we're now going to require vets doing animal physical rehabilitation to have additional training and certification, but not orthopedic surgeons and not cardiologists and not oncologists. So that's where I am.
Just to clarify on something I said earlier, that I'm not in any way suggesting that, and despite what I do for a living, that we should somehow regulate veterinarians and say that they're required to get additional training after graduation. I think it would perhaps help for the public and perhaps for some members of the board or the task force here to be aware of what is involved in the additional certifications and specialties. And I think we also have been tossing the term specializing around a little glibly when in reality someone saying that they are specializing in any service has to be board certified in that area. And that, Kristen, comes to your question about requiring continuing education. That anybody who's board certified now, the American Board of Veterinary Specialists requires that every college, every specialty college, have a recertification process that involves continuing education at a minimum. So I don't know that, I don't think it was beyond the scope of what I thought we were going to get into here to discuss requiring additional education for veterinarians. And I know that that's just such a huge, it would be such a huge piece to try to enforce. It's beyond our ability. But I think we need to recognize the limited ability of the typical graduate veterinarian to offer rehabilitation services unless they've had additional training.
Can I go? I'd like to hear from Western U.
That'd be nice.
Yeah.
Did Karen say her?
Oh, okay.
Yeah, Karen.
I have a deep concern about consumer protection, especially with the confusion about what rehab and physical therapy means to the public. And so they aren't able to necessarily differentiate between, you have this rehab center, that's run by potentially untrained people, though legal, but untrained. They buy the fancy equipment, the underwater treadmills, the lasers, but they don't necessarily know how to use it. And so it concerns me that you would allow somebody that may not know how to competently practice in a field where the consumer doesn't necessarily know who has been competent or not, if you don't establish some sort of competency standards for veterinarians, if it's not in their curriculum already. To your point, Dr. Heller, the requirements, at least from UC Davis, it looked like there was only, there was the club, and then there was, the rest of them were electives, I believe. None of it was core except for one of them, 433A or something like that, where it was 2 hours of instruction. So the rest of it was electives. And so I just don't understand. There's so much more to this specialty, this field, than a couple of hours to learn how to do this. And so when you put it in front of the public eye to have the equipment and these rehab centers that don't have anybody that is adequately trained to do so, and the public doesn't know the difference, I think that's dangerous and not fair, and it's not protecting the consumer properly.
So in the matter of consumer protection, what we currently have, veterinarians do have the opportunity to become board certified in a lot of different fields, including physical therapy and sports medicine. What that is additional educational training requirements, and then there is a college that administers an examination that you must pass to achieve your board certification. But what that really means, the only thing that certification gives you the right to do is to advertise yourself as a specialist. In other words, a GP can do absolutely everything that a specialist can do. There's no restriction on that license. I can do anything a cardiologist does, a board-certified cardiologist or a board-certified dermatologist or neurologist or what have you. I can't advertise myself as that, but that additional, as it is right now, that's all certification gives you. That is because of consumer protection is why we put that there. If a consumer wants somebody to address their cardiology case or their dermatology case, they can, I was going to say Yellow Pages, but they go online now, they look at Yelp and they enter dermatologist and so forth. So I think the consumer does have the ability to find somebody that we can have insurance that they have got that proper training and examinations to do. So if we're talking about consumer protection, again, that's the system that we have right now. There will always be outliers, people that are jackasses and arrogant bastards that feel that they are invincible and they can do anything they want and they'll eventually do harm, yes. But I think there'll always be outliers, and there'll never be a system that we can put in place that's going to be perfect, that's going to fix all the possible problems that can occur. And Western would like to chime in.
Yeah. I've been trying to be patient. So with, I didn't get a sheet until late, so it's not in our packet, I'm sorry. But we are, similar to how Dr. Choi talked about with years 1 and 2, it is a problem-based curriculum that the students are going to go through actual cases and learn their physiology, anatomy, pathology, pathophys, behavior, all of those things in the context of a case. And so they do that all through first and second year. And so anatomy and physiology, all of those things are woven in together. I think a really important thing and it kind of goes back to what Dr. Troy was saying, is that we're trained in all these things as veterinarians to make the diagnosis and the treatment plan, but that treatment plans are more than just if it's X, then Y is the therapy. That's not always the case. It's not black and white, in that we learn to deal with all the different variables, temperament, behavior of the animal, the compliance of the owner, the owner's constraints, the financial resources, expectations, even if they're feasible or not very feasible, from the owner, prognosis, all those kinds of things are going to play in. It's not just if X, then Y. As Dr. Klingborn and everybody else has said, that we can't learn everything in 4 years. And another thing that's Western is very strong as one of our principles is lifelong learning. And so you're going to come out with the basics to know how to learn what you're going to need as medicine evolves and continues to develop. So we're training students to continue to learn, and also that they're going to be specialists or become specialists potentially if they want to. If they want to become a cardiologist, there's residency out there just the same way that in human medicine. That's why the residencies are out there, is for people to specialize. And there's just as many pretty much in veterinary medicine as in human medicine. As far as the rest of we also have a club. Our club is called the Holistic Club, and it covers any complementary or alternative or therapeutic rehabilitation type modalities. And we have different speakers come in and talk about chiropractic, acupuncture, nutritional support, any of those types of things. And again, it's pretty much the students who are interested in that as a specialty that are going to be involved in those clubs, coming to those wet labs, coming to those lectures. In our third year, all students go through different rotations, covering small animal, covering large animal, covering ancillary diagnostic lab work type things. What I thought was important as far as our students that do 12 weeks of small animal medicine and surgery, where they're exposed to clinical settings in their third year, that they're going to be working with different hospitals. And if, as part of surgery, many surgical cases, there are going to be discussions of that aftercare, of that post-op care, and what type of rehabilitation might have to be. And the students are exposed to a lot of different things during that. They're also doing 4 weeks of equine rotation, predominantly where 2 of those weeks are predominantly lameness. And in lameness practices, there's also going to be a lot of discussion and exposure to the different therapy modalities for lame horses. In the 4th year, they have a core surgery rotation and a core medicine rotation that is not only supervised by the preceptor, the clinician that they're with, but also by a faculty member on campus. And so there's rounds, surgery reports, all types of different interactions between the preceptor, but also the faculty member on campus. And in either case of those, between surgery rotations, again, there's always going to be discussion about postoperative care, rehabilitation, and even in medicine cases, oncology would be one that comes to mind, where there's going to be discussions that these students are going to be exposed to for what is going to need to happen for that patient afterwards. And then lastly, we have a selective rotation too that would fit into this, would be complementary alternative medicine rotation, which predominantly usually is more of chiropractic, acupuncture, possibly homeopathy, that the students can select these rotations. And again, they're going to be working with a boarded specialist or a certified specialist, depending on what the specialty is. And they'll be spending 4 weeks with that practice or with that type of a rotation. The other would be the sports medicine. And so if they're going to a sports medicine performance rotation, that person is going to have to be boarded by the sports medicine college.
So I think we do have the ability to talk about the issue for the rest of the day. But at some point, I think that we realize that enough has been said to call for a vote on this. So I would propose that we vote on the DVMs. Is their education and training that they received sufficient?
Oh, yeah.
Well, do we need a motion to have? Yeah. I think when we made a motion, then that's when public comment opens up.
I'd like to make a motion. I move that this task force reaffirms that animal physical rehabilitation, as we have defined, falls under the practice of veterinary medicine as defined in 4826.
Question?
A second.
Okay.
Discussion then?
So it's discussion time.
Yeah. Did you just motion what we talked about, though? What did
Well,
you?
I did and I didn't. So it's a little bit more subtle. So the question is, did I just motion what we talked about? With this motion, we're reaffirming that this is the practice of veterinary medicine. We understand that veterinarians don't need a different level of supervision. And we understand that if it's the practice of veterinary medicine, that when you have your degree and your license, then you can practice. So with this, then, we have actually answered those other questions.
Just a question of parliamentary procedure. I'm a little perplexed. I have to be candid with you. If in fact, the theory is that they don't have to do that, wouldn't we be leaping to number 10? Because as I see it, the compression of the new Mass 789 was to sort of be discussion of things. And I think if coming out, flowing from that, springing from that is the final recommendation, I don't know if we're there yet, but it seems logical that now we're considering the output of the body. Am I correct there? Because
I don't think we're talking about licensing, enforcement, discipline, or other logistical and operational challenges on this one.
So,
I'm just, and maybe I'm misunderstanding our process here, but I'm not sure where this motion fits into the discussion we were just having about educational requirements for veterinarians.
I kind of tend to agree.
Okay, as I read this, I think that what this says is that this is the practice of veterinary medicine. Then when you have that degree, you have satisfied that requirement. If it's too condensed, then we can certainly add language. But we skipped this conversation at the last meeting. We
never got to it.
Well, what I would suggest, we're going to add on to what we've already done. And what we've already done was define animal physical rehabilitation, defined it, and we said that it is the practice of veterinary medicine. Now, what we would like to add to that is that that veterinarians have, what did you write? Could you read what you write?
So the task force today identified the 5 categories that we're talking about, which is veterinarians, RVTs, veterinary assistants, physical therapists, and physical therapy assistants.
Yeah, we voted on that already.
So that's been defined. So now it's what level of training, if there is any additional training for each of those categories of personnel is necessary. The discussion we were just having is how are veterinarians trained and whether or not the training they currently get within their DVM program is sufficient for veterinarians to go out and practice animal physical rehabilitation.
Okay, so we have to vote on this motion since it's been motioned and seconded, but I think that a more understandable motion would be that veterinarians have sufficient training and education to practice physical therapy. I think that's more understandable. I know we have to vote on the motion that's already there, but if it fails,
we can amend our motion.
If it fails or gets amended or gets withdrawn.
Withdraw it, yeah.
Or withdraw it.
We can amend and say, and therefore veterinarians have sufficient training. What was the other thing I needed to capture there?
I think if we amended it, it would be.
Okay, I'll withdraw the motion.
Sneaky,
okay.
I guess is a better way to say it. And I would like for us to continue with the level of cooperation that we have been doing so far.
So I need to understand, I'm not understanding now the language.
This is a recommendation that we're making to the board. I know that you're thinking in a lot of legislative and regulatory terms, and it will eventually be made into that. Right. But I'd like us to focus on making a recommendation. And
Chair Nunez?
Do anything until you rescind or withdraw the motion?
We've already done.
Okay.
Chair Nunez?
Yes.
Maybe a suggestion would be that we move on while people who are ready to make a motion find the language for it, or we come back to this to make the vote, knowing that we finished the discussion?
I don't want to go back to it. I'd like to make a motion that veterinarians have sufficient educational and training to perform animal rehabilitation. That's my motion. It's been motioned and seconded. Are there questions or comments from the task force members?
Chair Nunez? Thank you. I'm not going to vote in favor of the motion as worded, but I would vote in favor of a motion that said that we are not recommending that additional training or certification be required at this time for veterinarians in order for them to practice animal physical rehabilitation. Because I think several people feel that really the training isn't sufficient, but my position is we're not going to ask for a change because of the complications involved. It's a nuance? Okay.
Any additional questions or comments from the task force?
I would agree with what Dr. Heller has said, and that, is there a way, I don't know if there's a way in regulations to put language in that suggests that to do this properly, people should pursue additional training. It's not that it's a requirement, but that it's recommended that they would, or it's expected that, additional time would be spent before offering these services to the public. So,
as I think that we should make a recommendation based in language that is in the style of a recommendation, I think that we do have the opportunity to maybe say that we feel that veterinarians have the education and training required to practice physical therapy, but we also feel that it's something that if they choose to engage in this, they should get additional training and education. I think that is what happens already with most veterinarians, but I think it's appropriate to put it in our recommendation.
Just as a comment, I don't think we can say that it's okay for them to practice physical therapy, but rather animal physical rehabilitation. I think we could say that they have, at this time, exposure to the field of animal physical rehabilitation, that we as a task force would recommend that it would be a good idea for them to pursue additional training before offering this to the public. Because the level of training that they have at this point is, I don't think it's appropriate to say that. I would vote against a statement that says that we believe they have sufficient training at this point to practice physical rehabilitation.
Well, that's what's been motioned, but we added to that saying that it's our belief as a task force that if they choose to do so, they should get additional training, exposure, and so forth. But the motion does say that they can do it.
I don't remember hearing that amendment to the motion. No.
Right. I think at this point in time, we kind of need to figure out what, as your counsel, what you're voting on, because there's two things at play here. Number one, when you say recommendation, I'll use the word finding. So you've got essentially one. I'm not very good at math. You've got the 1/5 of your chart here, the DVM, what they're required for education, and you've got one category of that. So like 1/25 of what we've talked about so far. So springing from that, we have a motion and a second that this task force, and this is what's a little unclear to me, either finds or it recommends that whatever the rest of the motion is. So I just want to be clear for those of you who are playing along at home, what exactly the motion is, and if the maker and the seconder have accepted any of these various sort of informal amendments going on. So perhaps, Anne Marie, if you could tell us what the original motion was and the second, and we can sort of go from there.
We had a motion and second that said that the task force, the following policy statement, veterinarians have sufficient education and training to provide animal physical rehabilitation. That was motioned by Chair Nunez, or moved by Chair Nunez, and seconded by Valerie Fenstermaker. Val.
And then Dr. Van Dyke proposed an amendment saying.
And the amendment that has not been taken up yet in terms of added to the motion is that the task force recommends that additional training and education be required or suggested, I'm not sure where we're at on that, to veterinarians in order to provide animal physical rehabilitation.
The way that I heard it was that it was suggested, not required.
Okay.
Can I clarify a parliamentary point? I think a friendly amendment is being offered, and it's up to the mover and seconder whether or not to accept that. Okay, thanks.
I'm aware of that, which is why I made that correction. I haven't seen it fully written out yet. So can you read it again, the amended part?
The amendment is that the task force recommends that additional training and education is suggested for veterinarians to provide animal physical rehabilitation.
And I feel that that is a friendly amendment, and I would accept it. Carrie Ann?
I'd like to, I don't know how to do it parliamentarily, but would the word encouraged be entertained as a substitute for suggested?
Before we get there, we had the maker of the motion accept this friendly amendment. Where's the second on it? Does the second agree with that?
Does the second also have to agree?
Yes.
Who is the second?
Okay, so is that Ms. Fenstermaker?
So I have concerns about it because we don't do that in every other modality or specialty in veterinary medicine. We're making a suggestion specific to physical therapy, and I think the veterinarian education that we've been discussing encompasses this, and we should just leave it as the first motion. So I would withdraw my second if that is if that is where the direction you're going in. I would prefer to stay with the first motion and vote on it.
Okay, then, seeing how perhaps in order to get our business done expeditiously, what we might want to do then is we have this sort of unamended motion in front of us. And so your second is still good except for the friendly amendment. And so then why don't we, why don't we exhaust board member comment here and then present the motion out to the public and see where we are. We can test the waters. If that fails, perhaps another motion can spring forward.
Okay.
All right.
And I do realize that this is just section 1A of 5 categories with 3 different things, but I think it might be the longest one. So all hope is not lost. So we'll have an opportunity for members of the public at this point. I mean, I thought that was point 2. This recommendation goes to the board.
Okay, Grant Miller. I'm an equine practitioner, and I am a product of the UC Davis Veterinary Education. I like to think that I went there not too many rotations of the earth around the sun ago. And when I listened to Dr. Chow speak about the curriculum, I'm concerned that the very narrow and very specific questions asked of Dr. Chow about the curriculum leave not only this task force, but also the public with the impression that the veterinary education, at least at UC Davis, is lacking in some way. And Dr. Halland did a very good job, I think, of reiterating the concept that animal rehabilitation is ubiquitous throughout our curriculum. And when I went to UC Davis, although there wasn't one single subject that was neatly packaged under the subject of animal rehabilitation, the concepts of animal rehabilitation were carried through every aspect of what I did. Topics like lactic acidosis, muscle memory, muscle fiber types, scar tissue, pain recognition, which is huge in animals. That's something that the human side, the human physical therapists with their license to practice on humans, they do not see that. They don't get that in their education that I'm aware of. I don't believe that human physical therapists are doing that, but we'll address that in their educative requirements. So I want to stress that throughout my education, all the way down from the basics of biochemistry, all the way up to clinical application, animal rehabilitation was a core part of my curriculum. The other concern that I have is that the definition of animal rehabilitation, which was approved by this task force in the last meeting, is it is defined as the treatment of injury or illness to address pain and improve function by means of physical corrective treatment. To suggest that veterinarians get out of veterinary school deficient in that ability would suggest that they're deficient in being veterinarians at their core. It's ubiquitous throughout what we do. The other concern that I have is that as defined by this task force, the treatment, animal physical rehabilitation, I find that what's happening is there is this definition on paper, and then there is this gravitation towards the concept of knowing how to use an underwater treadmill or knowing how to use a device. And my concern is that definition that is being translated into knowing how to use these devices is not necessarily the definition of animal rehabilitation. It may have been chosen by a very few small select people who are choosing to practice outside their license parameters and work on animals without being veterinarians, but that does not necessarily encompass what animal rehabilitation is. I have the ability to use a hyperbaric oxygen chamber. I have the ability to use acoustic shockwave. I have the ability to physically look at a tendon or a ligament with an ultrasound machine to determine its size, the amount of edema in it, the fiber pattern, These are all superior methods of animal rehabilitation that I possess as a veterinarian. Those are not available to people who are not veterinarians. So the definition of animal rehabilitation should not be translated to mean that a veterinarian knows how to use a Pessoa string or an underwater treadmill. The subject is much more expansive than that, and we have education in that matter. As a final concern over the course of the conversation during the last hour and a half, it was brought up by one of the members up here that the purpose of this task force is to make sure that veterinarians are minimally competent in animal physical rehabilitation. That is not the purpose of this task force. Thank you.
This gentleman over here, actually.
Dan Segna, I'm the Assistant Executive Director for the California Veterinary Medical Association, and prior to being in this position, I was in practice, clinical practice for approximately around 30 years. I also graduated from UC Davis long enough ago that people were not talking about animal physical rehabilitation or any other form of that sort of treatment, but we also weren't learning anything about any kind of advanced dentistry or a number of other things that we take for granted now and are offered routinely in most veterinary hospitals as part of the treatment that we offer. There was a lot of discussion about the rotational choices and what about those students that didn't go through that specific rotation. My example is that I went through all the core rotations, which included surgery and medicine. While I was in the surgery rotation, I probably saw, because it's based on what's coming in on that day or that week or whatever, I experienced maybe 5% of the types of surgeries that I ended up doing in my career. I also, as part of my elective courses, took from a farm background, I thought that's what I was going to do. I took a large animal bovine rotation and a bovine surgery course, specifically on bovine. That was the last bovine patient I ever worked on. I took a avian exotic rotation, and while I did learn some things there, it did inspire me to incorporate that into my practice. But I really didn't see very much of what I actually ended up doing in my practice. And I worked in a practice initially when I was out of school that had a lot of exotic animals, and I ended up seeing them throughout my career. I did not learn in that course how to remove a urinary bladder stone from a tortoise or how to perform a cesarean on a bird. But I did all of those successfully in my practice because I went and made the effort and to train myself and to learn how to do those things. I'll also throw in, for the sake of you, that I had never, in all the years I practiced, I did not have a complaint against me at the Veterinary Medical Board. What I did learn, though, while I was in school that carried across through all of my career is the type of thing that we need to do to treat any case in veterinary medicine. I learned how to evaluate the presenting complaint. So when the client comes in and said, this is what's wrong with my dog. How to evaluate, take a history, a physical examination, and the diagnostic tests that were run, and to determine the value of each of those and to combine to make a diagnosis and a prognosis, and from there, recommend a treatment. And treatments are not always just pills. They could be any kind of treatment, including a referral. I did not do orthopedic surgery in my practice, but I knew how to make the diagnosis. I knew what the treatment should be, and I knew a good orthopedic surgeon that I could refer to. And that's just as important as anything else that we learn in veterinary school of what your limitations are. And the final thing that we do with all of these cases is reassessment. Things change. You've heard this already. Just because we've got a diagnosis today and we start down a treatment, things don't always go exactly the way we want them to go or the way we expect them to go, so we are constantly reevaluating that patient and determining if we're still on the right course. Diagnosis could change, treatment could change. And then my final comment is there's been a lot of discussion about the competency of the new grads. And I would say that the Veterinary Medical Board state examination and the national exams are aimed at determining the minimum competency to acquire a license in this state. That's true of all of the medical boards. I'm sure it's true of the physical therapy exams and also. And I would also say that I suspect that in any line of medicine, including physical therapy, that the students do not see or have exposure to every possible kind of case that they're going to see when they get out of school. So medicine is continually learning. If you don't learn, as has been stated before, and you don't stay on top of what you're doing and know what you're doing, you're going to end up talking to the veterinary medical board or a judge, and and your license is in jeopardy. So I think that this conversation has kind of gone astray. I think there are plenty of safeguards between the education, the examining boards. You heard the process from Mark on how they determine what's going to be on the examination, and just being in practice, having a mentor, knowing what your capabilities are, and then pursuing those areas that are of interest to you. That provides plenty of safeguards for the patients and the flexibility for veterinarians to take the education that they have and apply it in those areas that are appropriate and those areas that are of interest to them. So I would recommend that you end up voting on this, that a veterinary education is sufficient to perform the animal physical rehabilitation, surgery, or any other field of veterinary medicine. I don't see this issue as being any different than anything else we do every day. Thank you.
Okay.
Thank you. It's a very passionate topic, apparently.
Would you mind restating your name?
I'm sorry. My name's Ken Brucker, board certified small animal surgeon, board certified American College of Sports Medicine, Rehabilitation, and been in private practice for 33 years, 28 years as a tertiary referral center in Ventura, California. And my primary specialty is orthopedics, and so I'm a heavy user of post-op rehabilitation therapy. And I was going to reserve most of my comments towards the end because I realize we haven't talked about a lot of the other entities yet, so I'll try to avoid that. But I think that as a tertiary referral center, we've trained general interns for about 28 years, and so I've seen what has come through. I recognize what my own training was and lack of training I had at the end of my career as a veterinarian and before starting on to a residency. And I think the Veterinary Practice Act is certainly all-inclusive of surgery, dentistry, medicine, and as the comments we've just heard, I agree. I've been doing rehabilitation from the very beginning, just didn't know we had a name for it. You know, it was part of our post-operative care, as part of our just daily thing. So I think that from that standpoint, the general education does test core knowledge, not necessarily competency, but it definitely tests core knowledge. And I think you guys are facing a question really of competency and accountability. And I think that's where the rest of the topic's going to go. Clearly, I think every veterinarian should be covered under the Veterinary Practice Act by doing some rehabilitation. I don't think they should be able to call them rehabilitation therapists. I don't think they should be able to have a rehabilitation center, nor any more than they should open up a dermatology clinic without having that specialty training. I think that's where some consumer protection needs to be applied. And before I finish my comments, I guess I'll just say this. I use rehabilitation therapists a lot, and I'd say anywhere from 3 to 6 referrals a week for post-op rehabilitation therapy. I like to work closely with my rehabilitation therapists so that I'm doing and seeing post-op care. If they see something that's wrong, my expectation is they're going to call me and say, something's amiss, can you recheck this patient sooner than your 2-week recheck or your 3-week recheck? And all that being said and done, and I've used physical therapists that have been had advanced training. I use veterinarians that have had advanced training, and I've used RVTs with advanced CCRT and CCRP training. And honestly, of all of those, the ones I trust the most are the physical therapists because they have that 4-year of core musculoskeletal knowledge that we really didn't get as general veterinary students. So, thank you.
Any other comments from members of the public? What I would like to do is then, we had a motion to, read the motion again.
The motion was, the task force recommends the following policy statement: veterinarians have sufficient education and training to provide animal physical rehabilitation.
Okay. There was a second on that. There was also a friendly amendment made, which was accepted but not seconded. And we've heard a lot of discussion on this, and I would like to call for the vote and see where we are at this point.
Dr. Nunez?
Yes.
Lee Heller?
Nay.
Dr. Klingborg?
Yes.
Karen Atlas?
Nay.
Sandy Gregory?
Nay.
Kristen Hagler? Yes. Dr. Holland?
Yes.
Dr. Schlachter? Yes. Dr. Sims?
Nay.
Dr. Troy? Yes. Dr. Van Dyke? Dr. Waldman? Yes. Dr. Chow?
Yes.
Shalay Bar?
Shala.
Shala, sorry.
Nay.
Bill Gage? Nay. Carrie Ann Calais? No. Valerie Finstermaker?
Yes.
Leandra Clark Harvey?
Nay.
Does someone take a count?
Yeah, we did, but
I can't count in.
it may have been inaccurate. So can we call again?
Sorry.
I was watching
Here,
over his shoulder.
I'll keep count. Dr. Nunez?
Yes.
Lee Heller?
Nay.
Dr. Klingborg?
Yes.
Karen Atlas?
Nay.
Sandy Gregory?
I'm going to change to yes.
Kristen Hagler? Yes. Dr. Holland?
Yes.
Dr. Schlachter? Yes. Dr. Sims?
No.
Dr. Troy? Yes. Dr. Van Dyke?
No.
Dr. Waldman? Yes. Dr. Chow?
Yes.
Shala Bar?
No.
Bill Gage? No. Carrie Ann Calais?
No.
Valerie Finstermaker?
Yes.
Leandra Clark Harvey?
No.
The motion carries 10 to 8.
9? I have 9.
And I propose we take a break right now.
I have 9.
Oh, no.
I have 9.
Is there a hanging chat?
Do you have 9? I have 9. 9. I have 9. It's fine. We can coordinate. Nunez, yes.
Nunez, yes.
Let's take a break while they're counting their chads here.
Okay. Thank you.
Oh, 10 minutes.